Good morning. My name is Mark Votknecht. I work for the European Commission, DG Reform, the Director General for Structural Reform Support. I'm the project manager of this project, and I would like to welcome you very much to this workshop, both you here in person in Brussels and also the people who are joining us online. Apologies for the delay, but we will speed up. Before we go into the agenda, we have a digital stage manager, Jana, and I would like to give the floor to her for some housekeeping rules. Jana, the floor is yours.
Good morning. Good morning, everyone. Thank you, Mark, for the introduction. So I'm Jana, the digital stage manager, who will be facilitating a smooth interaction between the people in the room, in the conference room, and those online. First, please allow me to greet the participants who are on site in Brussels and extend a warm welcome to all those who are joining online via the Zoom platform. I will not be taking up much of your time, just a few minutes to go over some housekeeping rules for the online participants. So to begin with, I want to turn your attention to the fact that you have an interpretation option on Zoom, which you can access by clicking on the globe icon and choosing the language you want to follow the workshop in. During the presentations, please ensure that your microphones are turned off so we have a smooth sailing. But on the other hand, during the Q&A and discussion sections, we encourage you to be interactive and communicate with the speakers and the participants in the room. You can do this in two ways. You can either send us your questions via chat, or you can use the raise your hand option to let us know that you want to turn on your camera and microphone and be introduced to the participants in the room. During the event, I'm here for anything that you need, so you can reach out via chat to me. So before I give the floor back, I want to just wish everyone a successful and fruitful workshop. Thank you.
Thank you, Jana. And maybe important to add that this session is recorded. And I think these are all the logistics, and now we can start the workshop. And the first point on the agenda is a welcome address by Raluca Painter, who is the head of unit in DG Reform for projects in the area of labor market education and healthcare reforms. Raluca, the floor is yours. Thank you.
Good morning. Welcome to Brussels. For once, it's actually sunny, so we prepared nice weather for you. I would like to welcome you at this event that we organized together with TAIEX, with NTT Data, our expert provider in this the projects that we have in the area of digital skills for health. We see this as an opportunity to create new channels of communications amongst the different teams. The European Commission, through DG Reform, is working with a number of member states, ministries of health, to find solutions on how to better prepare the the health workforce at its different levels, doctors, nurses, other staff in the medical sector, to better use the equipment, which is being now used more and more at different levels of the care sector. So digital skills for health is really the topic which is focused on people, so enabling people to take most advantages of the innovation, the digital equipment, as I said, which is being brought into the medical system. We see that through different funding sources, and lately a lot through the recovery and resilience plans, many member states have huge investments into digital equipment in order to, let's say, to increase the efficiency, the quality, but also to bring more innovation into the health system. But of course, we need the people to be able to use this system, and we know very well that in the healthcare system, one of the big issues after the pandemic is keeping people into the profession. So the idea is not to put additional burdens on the medical profession. The idea is to find solutions and to help them gain time, to gain efficiencies in their daily work. So this is the, let's say, the simple objectives that we have behind the several projects that DG Reform is supporting in the member states. And this is why, first of all, we thought of bringing together the Ministry of Health from Italy, from Lithuania, Romania, Estonia, and Catalonia, the member states and the region with whom we have digital skills projects. But also, I would like to welcome the member states who are willing to bring their experiences today, so to share beyond these projects which we have with the several member states, so the Netherlands, France, Basque Country. It will be very interesting to hear how you are dealing with this issue of digitalization in the health system, how you prepare the people to use the equipment in the most efficient way. Now, there are common features between the different projects we have with Italy, Lithuania, Romania, Estonia, and Catalonia, but there are also some specificities that are at national level. Why? Because we know very well the situation is different in some member states where you have regions, you have a number of competencies at the regional level. So the idea is to put an emphasis on the common aspects, but also to let you exchange beyond the, let's say, the common set of challenges and the objectives that you have. So just for the other colleagues, but I'm sure that the Italian colleagues will mention this. One part of the project in the case of Italy is to look at the electronic health records and how to make the most of the RRF money in this direction. Then in the other member states, and I would like to welcome, we have a multi-country project with Estonia and Catalonia. So we're very happy that we have, I would say, willing ministries to cooperate together and they will talk about how this multi-country project is taking shape, the expectations, and the types of bridges, I would say, that it helped create. So I would like to encourage you also to ask questions, to take advantage of the coffee breaks and exchange more informally between yourselves, because at the end of the day, another big purpose of this event is to allow you to meet in person, to exchange, and then to also open up the communication, and in the future, beyond the specific events that we're organizing, to have some interlocutors to exchange, to ask questions, and maybe to discuss common issues together. So the agenda is really to try to give you an overview of the state of play, the objectives and the challenges of each of the projects on which we're working, but also then to hear the examples, as I said, from the member states with whom we are not currently having projects. And then we also intend to bring to you some updates from my colleagues in the European Commission. So we will have at the end of the day the opportunity to hear how EU funding opportunities through the Digital Europe program and EU for Health program could be a point to help you in the way forward and in the objectives that you have to address. So once again, welcome, and I hope we will have interesting discussions today. Thank you.
Thank you, Raluca. And I think you said it all. We have a few slides now that summarize or describe, what the purpose of this workshop, which really is to provide a platform for you to meet, to exchange experiences in the room and also during the coffee break and lunch. So we hope that will be a very active and interactive day. You have the agenda on the table. We send it via email, so I won't go through it now. Just to say that we start with a description of The joint project we have with Estonia and Catalonia, there will be an overview of what's going on in these two countries. Then we have a coffee break at 10:50. We continue with the project that we're running with Romania and Italy. We have good practice examples from France and from the Basque County. Then there will be a lunch break at 1 p.m. The lunch for those who are here in person will be served downstairs next to the reception. And then, as Raluca said, in the afternoon, we have a guest from the Netherlands, and then we look at other EU funding opportunities in these areas with two interesting projects and our colleagues from other Commission departments talking about other funding opportunities. So with no more delay, I would like to give the floor to Liliana, who is the project manager from Entity Data, and who will give you an introduction to the project that we have together.
So thank you so much. So welcome for all that are here, so on site and also remotely. So I would like to thank you all, and I would also call you to enjoy this session, because we are organizing this session for a few months ago. And it's, I think, very important to have this opportunity to exchange the experience among the different countries. Please, we don't want this session just to be presentation after presentation. If you have doubts, please go ahead, interrupt us with doubts, because we really want you to exchange ideas and also to clarify how each one of the countries is doing or is tackling each one of the challenges that we know that we all have, and more after the COVID pandemic, where digital is here, but we have also healthcare professionals with a very strong pressure, and some of them also with burnout. So we have, from the healthcare system perspective, really to perform actions that can help the healthcare professionals to work and give the care to the patients with all the resources that they need. So what I will have to present here, it's the project. The project that we are doing in Spain, so Catalonia and Estonia. But before, I would like to present a few numbers that I'm sure that you all know on why it is so important to do this skilling on digital health. Okay, so as you know, we live in the global era of digital transformation. So digital is now a reality. So the digital technologies have changed the world by removing the physical borders, automating and robotizing processes, enabling and access to information. We have a big amount of information now that we can use. We have a lot of channels of communication and collaboration, and there is being produced a huge amount of data, and with that data we have the capacity to do data-driven decisions. So, and this is very important for the healthcare systems and for the healthcare professionals to manage the care pathways of the professionals. And also this data now can give us the possibility of develop predictive models. So now we can anticipate the situations that are going to happen, and to do measures and plan our resources from the healthcare systems in order to cope with the challenges that we have. So with all of the spectrum of the technologies that we have, somehow we know that we are not using them in the full scope. And this is why we need to foster the digital skills on the healthcare professionals. So I brought you here, this digital health revolution is also happening in the healthcare sector. And I brought you here a picture that this Paul Sommier, it's a very influencer in the area of digital health, okay? And to complexify a little bit, is talking about that now we have the digital revolution. And so with the digital revolution, we were able to pass to a focus on the diseases and on the diagnosis to better start to manage, for instance, the chronic diseases, so through the use of mobile health applications and so on. But now with the genomic revolution, now we can go to what is called personalized medicine. So this help the systems to be able to predict what it's going to happen or that can happen with that patient and act preventively. And this is, I would say, a very strong and robust area that it's going to reshape the way that we do care, because we will go from the disease approach to the preventive approach that is the main objective of the healthcare systems. So I brought you here a picture. So this guy that could be a citizen or a healthcare professional is saying, so people are saying that digitization is key, but I can't find it. I can't find that key. So I'm sure that all of you have somehow passed in some situation where we were trying to finding the key and the key was not there. And so this is with the so dynamic progress of the digital revolution, and also in the healthcare sector, this happens so a lot to our healthcare professionals. And so that's why we have to do more capacity building and training to help them to be able to use this without so the device to be a burden to their tasks, and their main task is to care the patient. So this is an anonymous sentence that I found. I'm sorry, I don't know the name, but this says, the digital world can be a playground or can be a prison. So it is all depending on how you are using. But I would say, and I would add more, so it is not just how you are using it, is if you are willingness to use it, if you are ready to use it, and if you are trained to use it. It's not just on how you use it, but you have to have all the resources before to be able to use it. So, and just some figures on what is the current gap on digitization. So this is data from the European Parliament and so on. And what we have here is that 90% of the future jobs require some level of digital literacy. 1 out of 3 people is working in Europe lacking the basic digital skills to perform their jobs. 4 out of 10 European adult citizens lack basic digital skills. 61% of the European healthcare professionals have not received training or have received insufficient training in the area of digital skills, and 80% of the European healthcare professionals consider that training in e-health and m-health so currently is inadequate. So these numbers must give us a reflection on the importance on how we need. So the healthcare systems are spending a lot of money, so putting platforms, investing in digital health, and sometimes forgetting the needs of this capacity building in order to foster and bolster the use of these innovative tools. So more data. I'm sorry, these are numbers from 2016, but we weren't able to find numbers that were more recent, okay? But this was a survey that was held by the Digital Skills for Health Professionals Committee to 200 health professionals from different backgrounds and ages. And they were saying that more than 50% of the healthcare professionals felt that their training on digital health was not enough. The large majority of them, so almost 80%, were saying that they don't, so that the e-health and the m-health is going to have a significant impact on their career. And finally, and this is the data that I'm going to give, it is very important so for the ministries that are here represented and that are currently developing a strategy, that it is that 40% of the professionals say that the training should be provided early, so when they are studying to be healthcare professionals, and then continually through all their career. And this is very important. This training must be pragmatical and hands-on, okay? And what we see usually is that there are, when, I don't know, there is a software or IC tool that is implemented in an hospital, so you have, or the healthcare professional as the training from usually the software developer, but we are talking about other type of skills. It's not only the focus tool skills that can be leveraged, but also the more broad digital skills that are needed to use all the tools smoothly, okay? Okay, so why is digital literacy of healthcare professionals so necessary? So we have tried to identify what were the impacts for each one of the different stakeholders in the healthcare system, okay? So in the case of the healthcare system, and this is a non-exhaustive list, of course, but the fact that the healthcare professionals have digital literacy can help to improve efficiency, to really take advantage of the automatization and robotization of the processes. And if professionals do use the tools and do collect and register the data of their clinical practice, so the healthcare system will have more valuable data in order to do a better policy making and decisions. So it's what we call a data-driven approach. Then regarding the patient and the caregiver experience, we were talking this for several times that, and even before COVID, so the importance that the patient has interactions so that is treated besides the interactions that it has with the doctor and the hospital, that sometimes it is, for instance, for a chronic patient, it can be once each three months, no? But a chronic patient, when it has the diseases 24 hours per day and all the days of the year. So with COVID, fortunately, helped to design care pathways that are now combined with online interactions. The online interactions are very important to be able to foster the proximity and the accessibility to care, but also combined with on-site interaction. So it's not one thing replacing the other, but it is to try to make an harmony of the both interactions in order to also, and this is very important, empower the patient and the caregiver about on how they can treat themselves better, to foster the adherence to the therapeutics, and also to be able to cope with the exacerbations and better that these healthcare status. One moment. Okay, so regarding the healthcare providers, so of course, this is the same. So when you, the digital providers and mostly hospitals now are expensing a lot of money in digital tools. So using this can be useful to the strategic, clinical, and support processes definition, okay? And what we're saying also, it's that allows the care, it's not only made in the institutions. And so in COVID, for instance, the use of the digital tools was very important to the patients not to come to the institutions and get infected. So this helps also to the last point that I have here in this slide, which is digital health can also better the quality of care and also enhance the patient security. And then finally, the professional experience. So these are potential effects. So the digital tools can or have the possibility to increase the coordination and communication between the professionals. Also very important between the different levels of care, because sometimes they are in different buildings and so the communication is difficult. And now that we have also the challenge of be able to do more integrated care between health and social care. So these tools for the collaboration and the interoperability of the systems can really foster that the patient has a unique overview of their care pathway with independence where the professional is or where the professional belongs. And also, so professionals that are the early adopters of digital tools always say, so digital tools are very important because they can, now I don't see the presentation. So, but professionals that are the early adopters of digital tools say, all the data that we can collect from the systems helps in our decision making for the taking treatment care decisions, but also helps to foster research. And so now we are doing things that before we were not able to do because we didn't have the big amount of data that now we have. And this is the example, the clear example of the rare diseases, no? That, for instance, the European level platforms can put together so the different and the few number of cases that each one of the country has and can do research and came up with new treatments and new diagnoses in relation to it. So there are a lot of positive impacts of this adoption of digital health. So we have to help professionals to fully use it. Okay, so these are some numbers. So as you know, 2023 has been defined as by the European Commission as the European Year of Digital Competencies, okay? We put here that 20% of the funds from the Recovery and Resilience Mechanism were dedicated to the digital transition in EU countries. Not all of these funds are for the healthcare sector, and the ones that are for the healthcare sector, not all are for the capacity building on digital skills. But, well, this is already some important number. And of course, we have to mention the DigiCompt, that is the Digital Competence Framework for Citizenship. I'm sure that you all know. There is a self-assessment test that you can also assess your digital skills. So I invite you to do this. And this was defined by the European Commission as a starting point to assessing the digital skills of the citizens. And as we are going to see today, a lot of frameworks have their basis or their roots on this framework. Okay, so now I will present the project objectives. I have just 5 minutes left, okay? I will try to go fast. So I am going to focus more on the methodological aspects because then, Elisenda Serra from Catalonia and Catre from Estonia, they will present more the contents of the deliverables that we are performing. So just you to be aware, the general objective is to improve the digital skills and competencies among the Catalan and Estonian health workforce. And we expect as an outcome that both region and country have a strategy that can standardize on how the healthcare professionals have their paths on digital competencies and their training and their upskilling through all the career. So this is the planning of the project, okay? In the blue colors, you will see cross-cutting deliverables. So the 2 deliverables are benchmarkings on good practices. Then in Catalonia and Estonian stream, they are very similar. So what we have done is we are now defining the strategy, an action plan, a monitoring and evaluation plan. Also, the health professional digital competencies are in definition. In Estonia, there was a situation analysis that was not carried in Catalonia because in Catalonia was not needed. It was done previously. And then we are going to develop the training itineraries of the healthcare professionals and also their contacts. And we are going to pilot this and then hopefully present a report on how do each one of the systems have to scale up these presentations. So these are the stakeholders of Catalonia, okay? So in the center you see TIC Saúde and Social Foundation, which is a foundation from the government of Catalonia that is aimed to bolster the health and social innovations, okay? And so relating to the stakeholders, you see that there are a lot of stakeholders from the Catalonian government, but also professionals associations and universities. And the same in the case of Estonia. So in the case of Estonia, the beneficiary, it is the Ministry of Social Affairs, okay? And here we have a very complex set of stakeholders, but mainly are universities, other areas of the Estonian government, and also professional associations. And so I will now present rapidly the good practices report, if you give me more 2 minutes, Paula. And so this first report was to study the good practices on the definition of digital competencies framework for the healthcare sector. So we have made a desk research, we have selected some of the initiatives that we thought that would be more transferable or more relevant to the countries that have the project, and then we were able to perform a final report that we can share. So we have defined some research criteria. So just to put the long story short, we search for digital competencies framework that were very comprehensive, that have training contents defined, that had the certification processes defined, also monitoring and evaluation areas, and that would came from relevant institutions, and that would give or define the path to a new digital competencies framework to be inspired on. And so we have found 27 initiatives, okay? And then from these 27 initiatives, they were selected 8 initiatives. And per each one of the initiatives, it was defined, so a template describing the context of the initiative, what was the driving institution, the description of the digital competence framework, and what was the training and the certification tools that were used. So this is the list of the initiatives that were defined, okay? So fortunately, we will have in this session so the pleasure to listen to the initiative of Numeric and Santé from France, and Icanos, also from the Basque country. The two are very established initiatives regarding the digital competencies framework, and I'm sure that you will take advantage of hearing what they are doing, and mostly to understand what were the challenges that they are being through and what were the solutions and the measures they have taken to be able to do this training to the healthcare professionals. Then we have performed another benchmark, okay? This one was focused on the education and training pathways for digital competencies, and also on what are the governance models behind these pathways. So the same, we have selected some countries that had very high maturity level in the area of digital health and with other indicators, but you can see this on the report. We have performed the desk research, and then we have performed the report elaboration. And here we have also to need to set up some criteria, which was the criteria that was important to transfer to as lessons learned to Estonia and to Catalonia. So if these initiatives on training had a governmental or an institutional support, if they were made planned from planning to development through a collaborative development, because we know that it is very important and key to have all stakeholders on board from the beginning. Then if they had the availability of e-learning platforms or not, if the access to digital health tools and emerging tools were ensured. Also, if this country had or not a digital health strategy, and has one of the results that we have found is whenever you have a digital health strategy in the country, whenever you have this collaborative development with all stakeholders on board and the government institutional support, things go faster and better, okay? And then the sixth criteria was if they promote this digital culture from the governmental institutions. So besides the Ministry of Health or the Ministry of Social Affairs, if other ministries such as the one of Education or digitization were also on board, okay? And this is the final list. So Finland, Sweden, Germany, United Kingdom, and Netherlands. Okay, you will also have the opportunity to listen to the experience from Netherlands. So thank you very much also for coming. And we, in this description, what we have done is to, for each one of the country, describe what is the strategy, the policy, and the actions that were deployed by that country. What was the governance model? The governance model is a key issue. Also the education and the training programs that were set up and the methods that were deployed. What is the technology and the resources that were used? Also financing is here a hot issue. So this training has to be also accompanied for funds, okay? And also then the impact that was achieved or is expected to be achieved. And so, as conclusions, all of these countries have a digital strategy, then they have a health digital strategy. They usually have e-learning platforms. They usually have a definition of the roles and the responsibilities through the different stakeholders, from governmental stakeholders to non-governmental stakeholders, on what is the rule in the definition of the training itineraries. But you will be able, through the experience of Netherlands, to ask and dig for more information for the case of Netherlands. But all these countries shared the good practices of having a digital strategy, funds to enhance and develop the strategy, and good mechanisms of monitoring and follow-up. So now, and I will close now, where are we in the project from Catalonia and Estonia? So we were able to perform these benchmarkings, okay, that provided very good lessons learned to define the strategy. Now we are defining the strategy. The health professional digital competence profiles were already defined for Catalonia and Estonia. And then, so till the end of the project, we are going to tackle, so the definition of the training itineraries, the training contents, we are going to start to pilot them, and also elaborate what is the action plan and the monitoring and evaluation plan. And fortunately, we will be able to come with a final report with the lessons learned from that pilot experience, and with some recommendations on how to scale up this strategy to all healthcare professionals. So now I will leave the floor. I will not go deeper in the contents of each one of the deliverables. I will give the floor to Elisenda Serra, that is from TIC Saúde and Social from Catalonia, and then to Catre, that is the head of Human Resources of Ministry of Social Affairs, and that will be able also to present the results from Estonia. Thank you.
Okay, thank you very much, Liliana. Well, just a moment, because okay. So as Liliana said, I'm Elisenda Serra from Fundació TIC Salut Social. I'm a project manager at Fundació TIC Salut Social, so I'm not an expert in digital skills. Fundació TIC Social is actually a government body from the Catalan Ministry of Health, okay? So we receive assignments, formal assignments from our government in order to implement or to study some, in order to study how we can implement ICT or something related with ICT to the Catalan healthcare system, okay? So we are mainly an organization that we are piloting new ideas or processes or methodologies, so we are piloting that, and then the government decides if that can be implemented or not in the Catalan healthcare system, okay? So I will explain. Okay, so my presentation is going to be divided into parts. My presentation, can you hear me? Yeah? Also now? Okay, my presentation now is my presentation is going to be divided into parts. Okay, I'm going to explain in the first part what we did before we received okay, thank you. I will explain in the first part what we did before actually we received support from the TSI, okay? And then in the second part, I'm going to explain the activities and results that we have obtained since we start the support of the TSI instrument that it has been since last November, okay? So as I was saying, our project started some years ago, actually. It was in 2018 when the Catalan Ministry of Health organized a professional dialogue forum. Okay, in this forum, they wanted to align the planning the professionals planning and the organizational policies in order to address the population's new needs with respect to the health and the new model of care that they are coming. Okay, so in this dialogue, a different representative of most of the stakeholders of the Catalan healthcare system participate and gave their opinion. And for example, some of these representatives, they come from healthcare providers or healthcare associations, scientific associations, universities, unions. No, all these people, they met in several occasions in order to find which are the challenges that the Catalan Health Ministry will have to face, no, in order to improve the planning of the healthcare professionals. So this activity that is still active, no, the forum is still active, and some of the challenges that were discovered more or less in 2019 is still active, and there are still different groups of people working in this area. So from these 17 challenges, there was the challenge 4 that was unveiled during this debate. That was the need to improve the digital skills of healthcare professionals, no? And the Catalan government commissioned to the Fundació Salut to lead the deployment of a strategy in order to improve the digital skills of healthcare professionals. And then it was when the project, what we call Comdic Salut, that is, well, it's how we call it, born, okay, with the main aim to deploy a strategy to upskill the active healthcare professionals. So some of the main goals of this project are actually, as you can see here in the slide, to design a digital competence framework for healthcare professionals, because that doesn't exist at a European level until now. The second goal was also to create the competence assessment and accreditation model, no? So how we are going to evaluate this framework, okay? So because professionals, for their work, they need not to that all the training that they do, it's accredited, okay? Because this is for professional development. Also, another goal of the project was to lay the foundations for the elaboration of learning contents. And then we had to give support also in the creation of training itineraries for the assessment and accreditation of the competence. So at the beginning of this project, I'm talking about 2020, we actually were inspired with the ACTIC accreditation that is existing in Catalonia, okay? The ACTIC accreditation, it's a formal accreditation that is issued by the Catalan government that it actually demonstrates the mastery of ICT, of digital skills for citizens. Okay, so a citizen, if they want to prove their mastery on digital skills, they can have this exam. Okay, and they can prove it when they actually go to a job, when they apply for a job offer. Okay, the ACTIC certificate, obviously the framework of the competence, of the digital competence of the ACTIC certificate, are aligned to the digital Digicom, okay? And we have also 3 levels: the basic, the intermediate, and the advanced. No, so a citizen in Catalonia can go through this exam and get a basic level, or an intermediate level, or an advanced level. Okay. Then, having in mind that this certification already existed in Catalonia, we thought first, as a first premise, that we thought that our healthcare professionals, they had the intermediate level. Maybe didn't had well, the title, okay, but we thought that they really had the intermediate level. So with this premise, we decided that we needed to create a new certification that we call Actic 3 Health, no, in Catalan Salut. That will be the accreditation of digital skills for specific for healthcare professionals. Okay, so with that in mind, we start to work in two areas. The first one was actually to prove if we were right and if the professionals have an average level of digital skills comparable to the intermediate level, and then we start to work in the digital digital skills framework. Okay, so in the case of the of a study if our professionals had, which was the level that our professionals had, we actually designed a study, okay, that was a test based on this intermediate level of the DGCOM, okay, that is active that we have, this certification that we have in Catalonia, but we contextually, we make a kind of a small text, no, it was extrapolation, and we contextualize it to the healthcare sector, okay, and we launch it to all the healthcare professionals in Catalonia. We are quite happy with this study because we received very good reception. So more or less 800 health professionals actually responded to the survey. And one of the first conclusions that we arrived from this study was that approximately 63% of the professionals that participated in this study will not have the active intermediate level. No, also from this study, the professionals admitted that they needed some training in terms of IC tool and in the use of some of the tools that exist for in the Catalan healthcare centers. Okay, you can actually, if you are interested in this study, we have a publication that we published last year. And well, if you are interested, you can read some of the results there. And we also, we were working, as I say, no, we were working in parallel with the definition of the framework, and actually we come out with this was the first framework that we achieved, that it has 4 competence areas and 10 digital skills, and each of the digital skills had some specific indicators, sorry. So these will be the 4 competence areas, that they are access, management and data analysis, communication and collaboration, also professional development, and digital awareness. Okay, so once we have this framework, as I say, the professionals, they need to that all the training that they do is accredited. No, so we needed to evaluate, to design a way to evaluate if they really had reach this competence or not. So so also we were based in the ACTIC certificate, in the experience of the ACTIC certificate, and we decided to make a test, okay? But one of the main difference between citizens and professionals is that we are all citizens, but professionals, healthcare professionals, they may have different roles. So it doesn't really have sense that to make a single exam, no, for all of them. So we decided that it was necessary to define some profiles that will be, these profiles will try to cover all the possibilities of roles that the professionals they perform in their healthcare centers. No, so with the government, we defined on the 4 different profiles. No, so they are professionals that they are actually in direct contact with patients. Okay, so their exam should be more focused with their experience. We have also professionals that they don't have direct contact with patients. No, for example, a pathologist. They are professionals that they are working in the innovation, research, and teaching area. So and then they are professionals that are working in management roles. Okay, so although the competences are the same, okay, what we were thinking in this accreditation model was that each of these profiles had their own exam, okay, and it was but the competences were the same. Okay, so the framework was the same for all, we will just evaluate differently for each of these roles, okay? And the exam that we defined was an exam of 28 questions that we frame into challenges, and that it must be solved. It must be solved in 60 minutes, no? And a minimum of a score of 21 over 30 was required to pass this test. Okay, so this was a design of the model of the assessment, no? So the next step was to pilot it, no, as we did before. So we piloted, we launched it. In this case, we designed a pilot with different activities to be sure that the model that we have designed was correct, or to discover the flows of our model, no. So as a main results of this pilot that we carry on, I would say that here we obtained valid results for 122 professionals. We obtain here a bad result also for us, no, at least, that 50% of the professionals did not pass this intermediate level, okay, and then that 73% of the participants did not pass what we have designed, no, the Active 3 health exam. So we have here well, it's not a problem, it's just a stone in the road, no? What we see is that our first assumption, no, that our professionals had an intermediate level was not right, okay? So we had to revise. We had to revise our strategy, okay, and also to revise our framework, because was not correct, our first assumption. And we thought that if we are carrying with this assumption and we were carrying with this accreditation, it will not be successful, okay? So what at that point, because of the type of organization that I'm working, we requested for support to the TSI, okay, to help us well, to provide funding and also some expertise, okay? And now I'm going to present the results that we have obtained since last November. You have already seen this slide from Liliana. For us, this is one of the most important products that we expect from this project, because it's a strategy to upskill the professionals that we have, like 150,000 professionals that we need to train and upskill on digital skills. And then also the health professionals' digital competence profiles was at the end the revision of the framework that we had already defined initially, and also the revision of the profiles that we had defined. So regarding the strategy, it's still the document. Well, it's a work. It's that it's still we are still working on it, and it still needs some time because it's a complicated task to do. Here is the methodology that we have used. First of all, we identified the analysis as is phase. Okay, so how in Catalonia, who is in charge of the training of the professionals, how to accreditate the formation or the training, no, how the entities train their professionals, the healthcare providers. So here we had some interviews with key agents, and now we are more in the strategic definition phase, in the definition of the vision and the strategic lines, and we are going to prepare some strategic recommendations. No, in that case, what we need to arrive is a consensus with all the people and all the stakeholders involved in Catalonia in the healthcare sector. So this is some of the results of the strategy. First, we defined the strategic objective that is to develop all the health professionals through training digital skills necessary to provide health services to society in an efficient and sustainable manner. And also, it's very important to realize that it's important to foster cultural change to make health professionals aware of the benefits that digitalization brings to the health practice. We have also established some of the premises of the strategy. So the training that we are going to provide must be free for professionals. It must be based on practice. I will just highlight the most important ones. It must be based on practice. It has to be accredited and certified, and it has to give some flexibility and autonomy to the professionals. And in terms of the key elements that we will have to take in account in the strategy, we obviously need to define the targets. Okay, so we are talking about healthcare professionals, but there are a lot of people who works in the healthcare sector. So we need to see who are we going to focus in. We also we will need the leadership and governance of who is responsible of what. And also the incentive model for the healthcare professionals. If we want the professionals to upskill, we need to incentivize them in some kind of way. Regarding the health professional digital competence profiles for Catalonia, as I say, we had already a framework that we have defined earlier. And we also had some profiles of healthcare professionals. Here you can see the methodology. In the first phase, we actually make the analysis of the results, the previous results that we obtained, and then here we actually revise. As I say, this framework was based in a strategy, but we needed to change this strategy as a result of the pilots that we had carried out. So regarding the profiles of professionals, the four that we had defined early in the project, they are staying, so we still have them. But we have added the clinical administrations, that is a new role that the Catalan Ministry of Health has envisioned, and we will have to take it in account for the future. Nevertheless, the competence defined in the project are going to be the same, and they are going to be transversal for all the profiles. Okay, but in the project, we are going to elaborate training content for all the profiles. Okay, we are not going to make any distinction, but if it's important that, for example, having this selection of different profiles, it's important if you are actually want to create a specific training for them. Okay, more personalized. And then this will be the final digital skills framework for the healthcare professionals in Catalonia. There are some changes with respect to the first one that we released, but still we have 4 competence areas and 11 competence. So in this case, as I say, there are some changes that I will not enter in detail, but the work that we did was taking into account the first that we developed, and taking into account that our professionals, they don't have the intermediate level, what is needed to add here. Okay, so just to highlight that we have added this competence that before was embedded in another competence, but we have decided to include it as a separate one because it's very important nowadays. And for example, in Catalonia, we have gone through different cyber attacks in hospitals, and it has created a lot of problems. So we have decided to create this competence on his own. And that's our next steps. Besides finishing the strategic plan, we are going to be mapping in the next month the existing digital competence training initiatives that exist in Catalonia. This is to map and catalog the courses that they exist in digital skills. And it can be good for professionals not to give them this information, so that if they want to upskill themselves, and they can go through these courses. But also it's going to be helping us to identify training gaps. As Liliana said, we are now starting to develop the training content and the training itineraries. In that sense, what we need to do first is to prioritize which are the competence that we want to prioritize. So from these 11 competence and 4 areas, which are the most important, which are the needs that we have, and which are the ones that has to be first to start training our professionals. And then with these first contents that we are going to elaborate in the following month, we are going to test it in a specific pilot at the beginning of next year. Well, thank you very much, and I hope it's of interest.
No, this microphone doesn't work. Just to say that, please write down your questions. Now we have Katrin from Estonia to present the Estonian situation, and I think then we can discuss.
Good morning, everyone. Can you hear me? Nice. Well, first, I'm happy to be here, and I will, yes, like that. My name is Katra Trofimov. I'm from the Ministry of the Social Affairs, Estonia, and I'm the head of Human Resources for Health. The TSI project has been on my table from the very beginning. I'm going to briefly walk you through the time and the findings, what we have been working on ever since we started the project. And first, how did we even get here? The project initial request was sent in 2021 October, and it seems like a long time ago, but actually it has gone by very fast. And why we first even applied for this TSI project was the understanding that we see in Estonia that we have different contexts and different strategies around digital skills, health workforce. We have the e-health strategy. We are doing and monitoring the skills of workforce through the OSCA forecasting system. We saw from their reports that digital skills were something that are all the time brought up and mentioned that we are lacking of them, but we never understood more detailed what are we talking about. We also had different pilot projects where digital skills were trained to existing professionals, for example, the primary care family doctors and also nurses. And Tartu University started the DigComp assessment also for all the curricula in their university, and that also included the medical department one. We had ongoing projects at that time with the e-governance plan, with the integrated hospital master plan, where they were doing analysis on how we need to move forward, and also the health system performance assessment framework project. And in all of them as well, the digital competencies and digital tools and the workforce were mentioned. So we found out that we did not know what is exactly the digital competence definition, you could say, for the health workforce. What are the roles and requirements for the sustainable ongoing review of those digital skills? What are the competence profiles, and what are the competencies needed in the future curricula when we talk about the development of the technology and the digital tools which are being used? And also, if there are any standards for upskilling, reskilling, and how and if they should be implemented or looked. So the project has 19 deliverables, and 8 is for Estonia specifically. And it's been a very good and strong support from the DG Reform colleagues, starting from the project up until now, and now also with the main project team from Entity Data and our project team in Estonia, who is working very closely with all of our stakeholders. So it has been a very nice start. I will not go into details with this table because you have seen many versions of it already, and we have time to discuss all the specific parts later on. The inception report for Estonia was the first deliverable, the bigger one for us, which was important because that gave us the understanding of what we are doing, how we are doing, who are the stakeholders with whom we need to interact, and with whom we need to understand what are their needs in the digital skill parts, and what are their expectations as well. So we are very happy that we have the other ministries also coming along with us on this topic, because it's a field where you might think that health professionals are related mostly to the Minister of Social Affairs, but the education is related to different ministry, and the digital competencies and the overall digital development is very much with the third ministry in Estonia. So it's a great opportunity for us to also collaborate in this field. The second deliverable was the report on the situational analysis of digital competencies in Estonia. One of the most important pictures which we have brought out also on this slide is the understanding and the mentality around the digital competencies, that the digital competence itself consists of three items, you could say. That it's the skills, which is literally the skills, what you can do. It's the knowledge around it, and it's the attitude to be able to take in the new information, use the skills, the knowledge, what you want to be using in the future. And this slide is, and this picture is something we all the time emphasize when we have our workshops as well. We found out that the context specific strengths were basically that we have digital capacity and the trainers, which is a good thing. So we can already see what competencies we are training and how we are doing. We have existing and functioning e-health system. So we have in information system and digital tools already which are being used. We have remote service capability. Our doctors are using them, and also the recent years have been increasing that part as well. And in the strategic process of the health workforce digital competencies, all the relevant parties are involved. So we mapped out that we are actually in a quite good place, but to understand more in depth that what are those digital skills and why are we still all the time finding the arrow pointing at that we are lacking of them, we digged a bit further. And we understood through this report that also when we talk about the digital competencies, that the occupational profiles are not role specific, that there are no different digital competence profiles for different types of doctors or nurses or physiotherapists, because we rather found out during the analysis and the workshops which were held with the stakeholders. It was quite long working day workshop where we had 4 or 5 different mind exercises to get out from the current legislation how we define actually our workforce with who has more let's say access to different kinds of access to our health information system. So that was something which was in a way putting us in a box already, that okay, maybe we should look at this, how the legislation is saying, and then we can put the digital competence profiles according to that. But when we were doing our exercises in the workshop, we found out that no, it's not the way how we need to look at the digital competencies as we have defined the roles in the legislation, but we need to look at how they are being used in a wider scope. And we found out that the digital competencies is a transferable skill, like you could say communication and teamwork. And it's not reasonable to differentiate the approach to teaching digital competencies in that sense. There is a need for more efficient cooperation and clear division of responsibility among the parties. And there is a need to improve the digital competencies for the lecturers and the teachers of the health workforce curricula. And that was something which was brought out through the focus interviews and the group studies, and that came from different stakeholders. And we all agree on it, because if we don't have the trainers with the digital skills we need to train, then we can't expect the result to be what we need. And it was a recommendation also to add document analysis for some other curriculums. Currently, they were looking at the nurses, midwives, doctors, and psychologists. So that was a recommendation also from finding of this analysis. The deliverable 14, which was the health professional digital competence profiles for Estonia, was a document and a report where we looked more deeper now into those digital competencies. What are they? It was found out that, yes, we are talking about the general digital competencies and professional digital competencies. And they are both divided into 8 categories. So when before we saw that Elisenda was showing the 11 categories, then we could say that we currently have found those 8, what we are talking and looking more deeply into. And it's the information search, information processing, communication and cooperation of digital channels, creation and copyright, personal digital hygiene, cybersecurity, use of equipment and tools, and of course the attitudes and attitudes. That's important part, attitudes. Not only skills and competencies, but also the attitudes. And the profiles, which I just mentioned before, that in the legislation we have the roles mentioned in one way, and you could look also in the very occupation-specific part. But we decided also after discussing with our expert in the terminology, that we will stay with the profiles to the classification of occupation list. So we use the health professional as the person who is directly in contact and curing the person, the patient. And then there's the other health professionals who are working within the health sector, who are assisting, doing all kinds of technical administrating and other parts of the job, where it doesn't mean literally curing the person in the treatment part. Because with all the digital tools and the info technology and the health, and also with the point of having the lack of human resources for health, the administrative and all the task shifting that could be done to remove the burden from the doctors and from the specialists to do by the other people who can work in the healthcare system but are not doing the treatment part. That's the way we are going, and that's where we need to also focus on the digital skills, because we are talking about the health data, we're talking about the sensitive information in that part, and also the ability to have technology helping us in and making those processes more efficient. So all the digital skills in the end come to foster that. So unmet needs are that in the curriculums, the competencies are not clearly stated, and several categories are not sufficiently covered, at least by those analyses which were done by the project team and through those different activities. Very important, cybersecurity, also mentioned by Elisenda. The data quality, because it's the key for the primary and secondary use of health data, and the value what the health workforce, the people who are working in the system actually get from inserting the good quality data, that comes back to them as the information systems are getting more and more interoperable. They need to know what data can be used very efficiently and nicely to have the good outcome in the patient treatment as well. The use of a computer and related equipment, the most common office software even sometimes, but also the general topic of providing the remote services, problem solving, and the topics related to various e-solutions. For example, artificial intelligence and decision support addressed in those curriculums. We are also currently at the stage of strategy development to redesign the health workforce curricula and national governance mechanism in Estonia. The purpose why we need this strategy, it is to reshape the curricula because based on the findings before, we understand that there is a better integration needed for the digital competencies to be taught for the specialists. We are currently in the process, and we have had a preparation consultation with the stakeholders, with the steering committee part, and a little bit wider interviews and questions around it. In the strategy, we would like to give the recommendations for the development of the curricula. We need to also take into account all the findings we have found until now and make sure that we can use them and with our stakeholders find the ways to reshape the management and governance, because that was a good exercise where we looked at the responsibilities and who is doing what and when, where we found out that it's a very good time that we come together and we really look at the responsibilities of who updates the curricula when we talk about the digital competencies exactly, yeah? That who is updating, who is implementing, who is financing, do we do it in the curricula? Do we have like separate training? So that these are strategic questions which are on the table, and this project has helped us a lot to find this communication and discussion around the topic. When we talk about the strategy design as well, then it's something which needs to be not done by us behind the computer, but together with the stakeholders. So after today, when we have heard also what other colleagues from other countries are saying to us, we can take the best notes with us. And tomorrow we are also having with our project teams already a discussion around the strategies, that how can we take the key findings from here and improve them within our own strategies, and then go back to have the stakeholder meetings and send out the documents for comments and everything. It's basically going around the consensus building, because if we do not do that, then there won't be any changes in the future in the system. This is the workshop, what I was mentioning, that we were looking at the governance framework, that how we are working now. And as you can see, it's quite, let's say, colorful. And we were expecting like maybe one or two. These are the organizations or bodies who should be responsible of those actions here. It's like financing, curricula updates, the training, like saying the training need. And here we can see that in some boxes we even had like 4 different organizations, or that gives us a clear understanding that we need to look deeper on how and who is doing what. And next steps on the road. Action plan and monitoring and evaluation plan for the strategy. And once we have finalized the strategy plan, of course. And then training the trainers, piloting as well during the project. And then, of course, a report on the pilot. And then we hope that also during the project, all the open questions which we haven't tackled within this project, we can collect very nicely, and that we will keep continuing working on it. Not that it's something that we just make and then we forget, but the digital competences need to be developed all the time, as the technology is developing all the time, and the information systems and the data is becoming much, much more important. So I thank you and wish you a good day.
Thank you, Katra. We're running a bit late, but we have time for a couple of questions. I would like to invite Liliana, Katra, and Elisenda to join me. Otherwise, it's a bit lonely here. I would suggest that we collect questions, no, and then we answer them in one go. So, who would like to ask the first question, please, Sandita?
No, yes. So thank you for the really enriched presentations. I am Sandita Florea from Italy, together with my colleague Francesca Gastaldon. Actually, both projects, of course, were very complex, but I would like to ask first to the colleague from Catalonia, with regard to the mapping of existing digital competencies, if you could elaborate a bit how actually it has been elaborated, the mapping. And to the colleague of Estonia, with regard to, let's say, the last bits of the presentation and actually the very interesting fact about the digital competency that are not clearly stated in the curricula. I can see that there has been a lot of work done, but how it is then the relation with the stakeholders, what it involves then also this challenge of redefining and updating the curricula. I think it's really interesting and very, very linked to the topic. So I'm curious to know about it. Thank you.
Thank you, Sandita. Do we have more questions? Then oh. Okay. But let me ask Jana first if there are any questions online, and then we go into the answers.
So far, there aren't any, but I'm encouraging all the online participants to start sending in their questions or raising their hands, whatever they prefer.
Thank you, Jana. So, Elisenda, maybe you answer the question first for you, and then you're allowed to ask a question.
Yeah. Well, thank you for the question. Well, the development of the digital skills framework was done also with experts in Catalonia. Okay, the methodology was, first of all, identify all the frameworks that there already exist in Europe, or for example in USA as well. So we revised the literature. And then we take as the DigiCom was actually also there, okay, because it's the professionals, they are also citizens, no? So we took also the DigiCom as a framework, and we make a revision. This revision lead to a first competence areas and competence, and then we had a team of we have a group of people that is they are professionals of the healthcare sector, that they help us to validate all the stages. No, so this framework has been done with the consensus also of the healthcare professionals and experts in competences, digital skills.
Thank you.
I wanted to, yeah, Katri, just one question in regarding the these new competences that you have defined and the changes that you have to make in the curricula. There is a need to put a new legislation to change the curricula. I mean, do you need to change the legislation? I don't know. I think that in Spain, if you want to change the curricula, you need to go through changes in the legislation. So I had this question.
Yeah, thank you. First, I will reply to the first question and then to your question. If I understood correctly, then what you're interested is to understand if we found out the gaps in the curricula, that how are we going to basically make the changes or do the changes there? Okay. In our project, the work groups, we have 3 working groups: the technical, strategic, and one of them professional. Yes, thank you. Then also we have the representatives of the healthcare colleges and the universities there. So they have been all the time within this information and also giving themselves the information and also even helping us to reach the people who we want or our project team has wanted to interview or have the surveys done. So the input has come through and with their help. And that's also what we are really hoping that in this project, in the next steps when we are planning the strategy, which is the key point to understanding exactly how we can make those changes happen and the way we need, that to integrate all those rather in the existing curriculums than to maybe change the curriculums too much. And the second answer is that no, we don't need to change the legislation to change the curriculums, because it's the colleges, it's the educational organizations who manage their curricula, that how they do it. But it's something we can just discuss and oversee and look and have this done in a cooperative way. You could say that we need to change any legislation. Yeah, thank you.
Thank you very much, Katre. And I think we have to close this session now. So thanks a lot to the three of you for the presentation. Very interesting. We take a 20-minute coffee break. So we reconvene at 11:25. And then we go to Romania and Italy. Thank you. Welcome back to the second session of this workshop. So after listening to the presentations from Estonia and Catalonia, we now move to project that we at DG Reform have both with Romania and Italy, and we're very happy to have two colleagues here. We start with the presentation on the project on digital skills in Romania, and I would like to invite the State Secretary from the Ministry of Health to give his presentation.
Thank you. Good morning, and thank you for your kind invitation. It's a big honor for me to be here with you in the beautiful Brussels. I will present you the digital transformation, let's say, in the health sector in Romania. If I have the presentation on the screen, will be much easier. Okay, good. I'm Alex Rocobete. I'm State Secretary in Ministry of Health in Romania, and at my base, I'm anesthesiologist. I work in a big hospital in west part of Romania, and my first project was the digitalization of ICU clinic in my hospitals few years ago. So I'm very familiar with the digital transformation and how the doctors and nurses accept this important transformation in their work life. I don't have any conflict of interest to declare. In some slides, you will see some GE healthcare equipment, but it's just for teaching purpose. Sorry for my voice, it's from the plane. I'm COVID-free. Don't be afraid. Don't be afraid about me. And let's start with a digitalization test. Who use Facebook? All of us. But Instagram and TikTok? Oh, I'm sorry, this is not for. And smartphone? Okay, so you are almost there. We are almost there. So it's obvious that most of the doctors and nurses in healthcare like us live in a digital world. But in healthcare, the use of digital system often becomes a challenge. And the question is why? Because in 99% of cases of the medical staff, there is a very important transition, a transition from pen and papers from the classic way, yes, the pen and paper, which they learn, which they work, most of them from 20 years, 30 years, in a digital world. So here comes the challenge, not only the change of approach for the patients, but also the medical way of thinking, the medical way of prescriptions, the medical way of monitoring the vital parameters for the patients. And it's not just how to use an equipment. It's a change management for most of them. In Romania, now we have a lot of European funds for digitalization. For World Bank projects, we have 25 million. For resilience and recovery plan, almost 100 million euro. And in the next health operational program, we'll have 145 million just for digitalization in healthcare. And for the first time in Romania, we start to develop together with your help, the first national e-health strategy, and also we work together with World Health Organization because they are our technical assistance partner in RRP, in Resilience and Recovery Program. we start just with a few general objectives and a few measures, because I don't want to have a big strategy with a lot of activities, with a lot of measures, who in the end is not possible to be implemented. So we focus just on a few important segments, like digitization of the administrative flow of the medical activity in different specialties and segments, digitization of the financial and accounting flow, intra and inter-institutional data interconnection and exchange, because I don't know how it is in your countries, but in Romania, many data are not connected from different institutions, and it's difficult to have the same data in different institutions, if you put together, don't match. And for sure, the cybersecurity and data protection in healthcare is really important, and we put a focus on that. On RP, we have 4 components. I mean, the development of the IT system for National Insurance House and the interconnecting with all hospitals and all medical institutions from Romania, digitalization of hospitals, digitalization of for Ministry of Health and institutions in the field of healthcare, I mean, Ministry of Health subordinates and so on, and development a new telemedicine system and mobile patient monitoring system, mostly for the remote areas and for the isolated patients. About the digitalization of the hospitals, this open call for the projects, it's ended 2 weeks ago. We have 245 projects submitted. Now we start for evaluation, and our budget will be for the minimum 200 hospitals to be digitalized, so they can use the system for clinical data management, multi-parametric digital monitoring of medical data, data migration, all digital systems for ICU patients, for radiology and imagistic, microbiology labs, and so on, and also for rehabilitation, the IT infrastructures in the hospitals. Now we start the telemedicine project in Romania. Also, we have 100 million euro for that. We try to make a national system to cover all the regions in the Romania and to be coordinated by the Ministry of Health. For sure, we have other digitization projects in Romania. Now we have the SIEC ATI. It means to develop an informatic systems for ICU in Romania. We have 19 hospitals included in the project, around 1,000 ICU beds and around 250 operating rooms. The project is done in the first part of New Year. Also national registries of transplantation and other registries for other diseases. But digital transformation is not just a project, it's a process, and it's a hard process. And we are lucky in Romania because we don't have any digital system in healthcare right now. So we are not a digital country, as you know. So we just start, and it's very easy because we start from zero. We start with a lot of experience from European Commission, from World Health Organization, and from other people. So it's faster and easiest because we build from zero everything in a logical way. Let's say, I will give you an example. For the project I had in my hospital a few years ago, was the first ICU completely digital, free, paperless, 100%, and now they work just in a digital environment, let's say. But the way and the project was not easy. Like I choose this picture because it represents very well the way of our project in the last 2 years. So, as you know, the old ICU papers look like that. The vital monitoring for every patient, the treatment, the nurse need to complete by pen, by hour, by 30 minutes, all this data. And the most important thing is the doctor and also the nurses need to understand what is right here, you know, and to to take a decision from medical point of view. Now they use this system. It's a digital system who collect automatically for every equipment, ventilator, monitor, or other equipments in ICU. They collect all the data minute by minute, and they create the digital record for these patients. The digital transformation of prescriptions for sure, and very important in an ICU, in an emergency county hospital, is to have a general overview of the beds, to know how many beds do you have free in case of an emergency, let's say, or how you can move the patients from from a sector to another sector, depends on the pathologies of infections of everything. So also the statistical analysis and educational tool with our system, we know every resident, how many hours they spend in OR, how many hours they spend in ICU, how many IV I don't know, they put, we count everything, the consumption of drugs and also the economical point of view. It's important also for the economical point of view. This is the way how it looks, our ICU, fully digitalized. Every bed have a PC, a medical PC. What means the electronic record for the patient, and this is the central station from where the doctors and the nurses complete the prescription and the treatment and see the patients and everything else. So this is my hospital. So the digital transformation is a real challenge because it involves to prepare all the infrastructure in the hospital, the IT infrastructure, the servers room. This medical PC need to be mounted not in a, let's say, friendly environment, because I discuss about ICU and operating room. To prepare many different people from different specialities or different ages, because it's not the same thing, to change their vision and to learn the people to work in a digital environment. But yes, this is from our workshops. The training for the people was 1 year daily. From the company who win the project, 1 people stay in our hospital 8 hours per day, 1 year, and they work daily with every physician and with nurses and with personnel and with medical staff to adapt and to, let's say, to make the transition from the papers to the digital. 10 minutes. I'm fine. I will finish in 5. So now this is how it looks, digital ICU bed with all the equipments and the digital system. And this is how look an happy ICU team, because now after 1 year and a half, they don't want to get back to the paper and to the pen. But in the beginning, they don't want to use the digital platform. So the transition is very, very important. So this was our biggest challenge, and we understand how important is for the human resources to benefit from adequate and extended training adapted for everyone's needs, because the needs of a nurse is not the same with the needs of a physician, and the needs of I don't know, person of 20 years is not the same with the needs of a person with 55 years. So we need to adapt and to make personalized training and education for everybody because the needs are not the same. But how we can do this? We do it with vision. We do it with a strong team. We do it with a strong company because we need support for sure for that. And always time for a beer and any condition. Thank you so much. And now I invite our partners from Ilfov County to describe you a bit the TCI project in few minutes. Thank you.
Hello, my name is Ionica Elena from Ilfov County Council, and I will present Ilfov County in a few words and our project. Digital Skills for Healthcare Professional, the pilot project in Ilfov County, is a program meant to accelerate digitalization at the multi-level remote healthcare. This project has two main ambitions. The first one is to merely enhance the digital skills for the healthcare professionals in Ilfov County. The second one is to aim the offer to a broader national framework for the entire healthcare system in Romania. It should prove the efficient level of the county, and after it should be replicated for the entire country. The ultimate goal of the project is to reduce the cost of the public healthcare and to increase the well-being of Romania's citizens. Ilfov County is different from the other counties in Romania because it surrounds the capital of Romania, Bucharest. So it belongs to the region Ilfov, Bucharest-Ilfov. Ilfov County has 4,100 inhabitants and 40 administrative territorial units. The Ilfov County Council is the authority of the local public administration that coordinates the activities for the communal and city council in order to provide public services for the interest of the county. For this project, the hospitals that are located in Ilfov County are included in this pilot project. There are 6 hospitals: Ilfov County Clinical and Emergency Hospital, Obstetrics and Gynecology Buftea Hospital, Eftimie Diamandescu Hospital, Ana Aslan Sanatorium, and Domnești Medical and Social Assistance County for the chronically ill. And the last one is the Periș Elderly Care Center. For now, we are still working for the questionnaires for the doctors and the healthcare professionals. Thank you.
Thank you very much to both of you. I think it's an important aspect of this project that we work both at the national level with the ministry, more like on a policy and strategic level, and then with one region in Romania, the Ilfov County, to test new ideas. I think that's important. Also, I want to say I really like the digital transformers picture. Maybe we can use it to promote the workshop on social media. Come back to you. Okay, we move directly to Italy. We have Sandita Florea from the Ministry of Health. The floor is yours, Sandita.
Thank you very much. Okay, can I see if this is working like this? No? Yeah. Getting back? Okay, perfect. So good morning again. Thank you very much for the invitation. I would like to mention that I very much appreciated the presentation from the Romanian colleagues because I don't have a scientific background. Okay, so we will have the opportunity to get more into policy, but thank you for really the practical examples. Before starting, I would like to mention that today I am representing actually the steering committee from Italy that has been developed within the this project, TSI project, Digital Skills to Increase Quality and Resilience of the Health System in Italy. Specifically, the steering committee is composed by the Italian Ministry of Health, the Department of Digital Transition, AGENAS, which is the National Agency for Regional Healthcare Services, DG Reform, which has been an added value, of course, and Promise. I am part of the Promise team together with my colleague Francesca Gastaldon. She is based in Brussels. I'm based in Italy. Promise is an institutionalized network representing the Italian regions and the autonomous provinces and also the Italian Ministry of Health. We have a specific governance that will make you understand, let's say, throughout the presentation, our role and the support we are giving, because we are able to support the regions, we are able to support and foster the participation to the European processes. And of course, our role as connectors has been relevant in this stage. Then, the presentation, let's say that it will be divided in three parts. First, a brief, let's say, scenario with regard to the digital and innovation sector in Italy. Then we will get into the project that we have developed. And then in the last part, of course, we will talk about the next steps and the synergies. So as you can see, okay, we've seen already some facts and figures, but again, I just want to point out that according to the Digital Economic and Society Index in 2022, Italy has been ranked as third last country with regard to the basic and advanced digital skills, meaning that about 23% of the individuals have been identified as advancer with regard to the digital skills. Of course, the national health system, so Sistema Sanitario Nazionale, has started a process of digitalization that, of course, we are living throughout the whole Europe with several challenges ahead. I will not focus on the other figures, but the only figure I want to focus on is the 48% of general practitioners access with regard to the tool used, because we will come back to that later. Okay. Now, very important already to point out a characteristics of this project. In Italy, the scenario has been very much linked with the national recovery and resilience plans investments that have been aligned with the digital innovation sectors and priorities. Specifically, throughout the call on the TSI flagship that we have participated last year, it has been indicated, let's say, the synergy and the complementarity with this instrument. Therefore, the mission 6, of course, on health, we know, and the component C2, specifically on the innovation, research, and digital transformation, has included a pervasive requirement for digitalization, interoperability, and exchange of data. Okay. Now, this is a bit more, let's say, technical and specific slides, but I would like to point out that, as already actually anticipated by Raluca from DG Reform, the head of unit, these investments have been focusing at first on the reinforcing of the electronic health record in order to ensure its dissemination, homogeneity throughout the national territory, and the accessibility by the healthcare beneficiaries. Therefore, let's say it was essential to ensure a single access point to the healthcare services for the citizens and patients, to ensure a single source of information for the professionals with regard to the medical history of the patients, and very important, and here of course our role as promised has been fundamental, to ensure also that the health authorities, regions, and the Ministry of Health would have the availability of the necessary tools to carry out the data analysis. As you know, probably, the regions in Italy have a very specific and peculiar system. So we are actually, as the regions and autonomous provinces, acting through the local health authorities, divided into each region. Okay, so the objective, as you can see, and also the colleague from Romania has mentioned the architecture, the technical architecture for the digital accessibility that has to be developed, and of course the electronic health record supply. You can see the target before 2024, 2025, and 6. And I want to get back to the 85% aiming, let's say, the target for the general medicine practitioners to actually use the electronic health record and, of course, to adopt it. And then you can see also the total of the investments. Of course, not to mention the physical migration from the documents and the software adaptation that it has been already actually discussed by the colleagues. Okay, here we are getting more into the project. Let's say that it has been fundamental already, as I was mentioned, the steering committee role. And the steering committee, formally, it has been composed with the beginning of the project. That was end of October 2022. As I was mentioning, these are the entities part of it. So we have been requesting the support from the European Commission in order to enhance the skills of professionals and support the adoption and implementation of the electronic health record. Okay. What does mean for Italy specifically? It has been necessary then to aim to the definition of a shared national strategy throughout the unified approach, and at the same time to facilitate the adoption of the electronic health record, again throughout a unified strategy, and very important, with specific operational guidelines and operational plans on communication and training. Why I'm pointing out this part, again, because given the nature of the health regional systems in Italy, it has been fundamental to work since the beginning together with the regions and autonomous provinces in order to really facilitate and foster the implementation. Okay, this slide is just to provide a bit of a timeline since the publication of the call for tenders in April 2022, the closure 1 month later. In this case, the project has been supported by Deloitte, and as I was mentioning again, the establishment of the working group. Thank you for 10 minutes. I think I will be on time. Again, not just to repeat the information, I think it is quite clear also the definition of the specific objectives. Okay. Apart from what I have been already pointing out, it is of course also the definition of the useful indicators to monitor the results, and the again the operational guidance and tools that have been then very much linked to operational plans of the regions and the autonomous provinces. There have been identified 2 key deliverables. One, it is the strategy for the digitalization, and one, again, the operation guidelines. Given this specific definition, of course, we have also identified 3 project streams. The electronic health record 2.0 communication has been already approved, whereas the one on training and digital skills trainings not yet, but now we will get into, because we are very much close to the finalization as well. So what, again, we would like to mention that in order to achieve these objectives and to meet the target, it has been about co-designed process. It has been about the collaboration, the essential collaboration among the central government, the regions and autonomous provinces, the federations of professional orders, and of course other stakeholders engaged. In this case, what we would like to mention also is that this particular instrument, it is innovative, it is powerful, because we believe that it is different from other programs, and the real added value also is represented by the presence of DG Reform, that since the beginning, regardless, let's say, the results of the proposals, is supporting the strategy, which helps very much in defining the objectives, and at the same time, it allows the national institutions to understand the processes, to understand what has to be reinforced. And of course, also the presence of DG Reform represents also, from an institutional point of view, a guarantee of implementation. So really, we are very much grateful, and we take benefit from this instrument. And at the bottom, you can see actually the different phases. Okay. Again, as you can see, we were focusing very much on the stakeholders. Actually, you can see the different layers at the top, the EU institutions, the national entities. Also, for us, it is essential to, again, stress out the importance of the connection and the collaboration among different entities at the national level, being not only the Ministry of Health, but also the other departments of digital transformation, the Ministry of Labor and Social Policies, and so on. Then the third level, of course, as you can see, Adonai Promise at the same level, representing the regions, and then the local authorities and the other stakeholders. Okay, as I was saying, we are towards, let's say, the completion, okay? After the definition of the inception report, the situation analysis, now we are actually defining the 2 deliverables I was mentioning before. We will design also a change management methodology, which is about an approach that has to deal with actually a transformation process, and then the action plan. I will spend also a few words on the action plan, and again, the link with the role of the regions. And of course, we can see that these, let's say, objectives are already very positive. But what is the real challenge nowadays? It is to really implement and bring towards the end the project, of course. So already on the 6th of October, we, as promised, we are organizing a webinar with the regions and autonomous provinces in order, again, to get through the project and to discuss the next steps and to ensure the real implementation of the action. Towards the end, we would like to mention also that Participa platform, it is a platform in Italy that is supporting the public administration, okay, and the consultations has been already launched on the platform, the 2 first on the slides, and it will be available until the 20th of October. Okay, as you can see, you will, I'm sure you will have the slides so you can dive in better. And then at least we will want to again represent just quickly the synergy that we are trying to develop as promised within also other programs. So as you can see, starting from Horizon Europe, we are part of the Partnership on Transforming Health and Care Systems. Then we are also part of the National Program Health Equity within the cohesion policies, and it has 4 cross-cutting strands: mental health care, increased cover of cancer screening, gender-centered care, and tackling health poverty. Then the joint action under EU for Health, Healthier Together Workforce Initiative, and HPAS, which is a project, a vertical project. And I would like to mention that in the call, of course, there was the specific evidence of creating synergies with the TSI digital skills. So we have been working on that. So what I would like also to mention is that as promised, again, with the supporting the ministries, we are also part of other 2 TSI projects on integrated care that started, the Youth First that has to start very soon. And we are also working on the actual call that will end at the end of October with regard to the AI in the healthcare sector. Also, what I would like to mention that it has been an honor for me, as I am from Romania, but I was representing Italy with the Italian hat for this presentation. So I was really happy to be in this panel. Thank you very much. Here we are.
Thank you, Sandita, for the presentation. Now it's time for questions. Can I ask the 2 colleagues from Romania to join us here on the stage, please? Your questions, please, either on the Romanian or Italian presentation. Otherwise, I might have a question. No, please go ahead.
One. Thank you for the presentation. Quick question for the Romanian representative about ICUs. Are the ICU PCs that you use for the data collection connected to the internet, or are they just local?
No, are not connected to internet. It's a local VPN connected just with
Other questions, maybe related to what you described, the change in the ICU unit in the hospital. Was that like focused on that hospital, like in a pilot project sense, or is this now scaled up throughout the country?
Yes, in the beginning we tried with my hospital because it was easy because I was there daily, and now we have a national project. I told you about the CIEC with 19 hospitals, and now we increase the project to minimum 200 hospitals in Romania by RRP, by Resilience and Recovery Program.
Okay, nice. Please.
Well, I would like to have questions for the State Secretary from Romania. The first one is that during this year of training, if you included administrative, for the you said, that would be the question. And the second question would be, I understand that each hospital has the UC digitalized, no? Do you have some kind of control center to know around the country if you have 3 beds in this hospital, 2 beds in there? Yeah, you have it? Okay.
Yes, we have in the Ministry of Health a department named the Center for Operation and Emergency Situation. And they see everything from the country. They see the number of ambulances, they see the number of free beds for ICU, for burns, for trauma. They see the patients in the emergency department also. and they control, they move the patients in case of an emergency situation. This department, they, let's say, move the patients or reallocate the patients, depends on the free beds and depends of the pathologies. Because if we discuss about trauma with head or with spinal, they redistribute, let's say, they move the patient to a specific hospital where they can give the yeah.
There was a second question about the
Yeah, but I forgot the first question.
yeah.
If you could repeat, please.
If during this year of training, the administrative, they were also included in
Yes,
this
yes,
training.
for sure, yes. Yeah. Because the system is connected also with the administrative parts.
Okay, also for the state secretary. So the numbers you have shown are huge numbers regarding the investment. So I imagine that this is quite challenging to implement everything once. And so I would like to question on how are you doing this change management? Also, how healthcare professionals are tackling so many changes in their daily and current practices, and what are the bottlenecks that you are, or resistance that you are identifying? And also, I would like to ask, the primary care is also within all this digitalization strategy? Okay, thank you.
Yes, this is the reason why I don't answer to your emails every time. Because of this, a lot of projects in the same time. We work with a big team. In the Ministry of Health, we have for the RRP, we have a dedicated big team. It's a new team, but they are very good and they learn and they understand the importance from the Romanian healthcare system to use all of this money. For the primary care, we use the telemedicine project in the component 4 of our RRP. They will be included in that component, and we equipped 3,000 medical primary care offices with equipments and also with digital systems. And at the end of the RRP, I mean, at the end of 26, we will connect all of them in one system. This is for the primary care. And the second question?
No, it is how you are tackling. So this
yes,
was answered, but how healthcare professionals are reacting to all these changes?
Like everywhere in the world, I think. In the beginning, they don't want. They think that will be, let's say, they need to work more with the new system because they need to learn the new system. They need to adapt for a new vision and a new treatment and so on. But I think after they feel the benefits of the digital system in a hospital, they will be happy and they will use it without any issue.
I have also a question to Italy. You are almost finishing the TSE project. And then you will have the challenge of being able to implement the strategy at the national level. So in this regard, what do you foresee that will be the main levers that will help to implement really this strategy?
No, I think it works.
Yeah, sorry. Yeah, okay. Any light. Thank you very much for the question. Indeed, we believe that at this stage, it is essential still to maintain the connection among the institutions that I have been discussed. Maybe, yeah, I was pointing out a lot, let's say, the importance of the different stakeholders. And also this morning, my questions was very much related to this, because in our case, given the nature of the Italian ecosystem, it is really important to let's say ensure the right connection from the top to the bottom, the ramification into the territory. This is why we are a team of different stakeholders and entities at the national level and not only at the regional level. Specifically, a few weeks ago in Veneto region, where our organization Promise is based, we have been working on a training that was connecting all the local health authorities of the region, so the representatives, of course, and we tried really step by step to discuss with them the strategy on how to support the internationalization. And of course, we've discussed also about the other initiatives. And of course, still, there are some gaps because each local authority, each specific, let's say, province, this is how we are divided, have their own, let's say, peculiarity. For instance, Vicenza, there is an American base, and they were pointing out that this was a priority at some time because they needed to somehow connect with many thousands of American patients and citizens into the national health system. So for example, okay, so this is just to make you understand how we are working. So getting back to the question, of course, we as Promise, we have this capacity to support the capacity building of the regions. So we are very much committed to implement this this project. We have also the capacity throughout also the other projects participation to connect with the other entities. And we believe that also the development of synergies and complementary action will support step by step all the initiatives. So we believe that this is one, let's say, reinforced point that we are having at the moment, but we are counting, of course, still on the funds from the EU and the national funds. I don't know if Francesca wants to add something. Okay, great. Thank you.
Thank you.
I have a question for Romania. Can I?
Yeah, go for it, please.
Yeah, so you mentioned that, of course, maybe in Romania we start from zero. And it is positive, and I understand why. I'm just curious to know a bit, again, very much linked to our experience, how is the interaction with the other institutions, the other ministries, also given the fact that, as also the colleague mentioned, you still need to manage different funds from the EU.
Yeah, thank you for the question. I think you put this question because you know very well Romania. Now is not so difficult because every segment, let's say, have the same funds for digitalization, and we prepare the national digital government. I forgot the name of the project. That means all the data will be in the same place in the government. So every ministry with every field, with every ministry as coordinator needs to digitalize their segment, and in the end to be connected in the government in one big digital database. So we work very well with other ministries, and in our field, in the healthcare sector, we, for the national strategy of e-health, we work with all institutions. Also, like Italy, Romania is divided in 8 regions. Every region is represented by insurance house, by public health department, by hospital, university, and so on. And we work together. So we have representatives from every institution and from every region. And we have a lot of, they work together for the national e-health strategy to be, let's say, in the same line with the needs and with the infrastructure from every region. So we not develop the strategy at the Ministry of Health and we will put on the country, do it because we do it. So no, we work together and we try to do it step by step. from infrastructure to solutions, digital solutions, to training for the staff, and at the end to connect all these informations in one system. Thank you.
Thank you. I believe lunch is ready, but we have the privilege to continue the discussion over lunch. I just want to check with Jana if there's any questions online.
Apparently, the speakers and the follow-up questions covered all the relevant aspects, so there are no questions from the online audience at this point.
Okay, thanks a lot. So thanks to the speakers of this session. Thank you very much. So some logistics. So
he's ready to get connected.
like now.
Yes, yeah, then we start afterwards.
Aha.
Yes.
So there's a change to the agenda. Lunch has to wait another 30 minutes. We have our colleague from France, from the Ministry of Health, who will talk about one of the initiatives identified when we were looking at good practices in Europe, Numérique en Santé. So Mathieu, thanks a lot for joining. It's a pity that you couldn't be here in Brussels, but we're very happy to have you online. The floor is yours.
Okay, thanks. Hello, everyone. First of all, I would like to apologize to not be there and moreover to delay your lunch, but I will make it quickly. So it's really a pity to not be there, but it's really an honor to present you what we try to do for digital competencies for healthcare professionals in France. So as you mentioned, I'm a project director in the Delegation for Digital Health in the French Ministry of Health, which is a delegation that pilots the digital health transformation. So the digital health, of course, didn't begin in 2018 in France, but by that moment, government decide to create the first digital health roadmap. It's very important because at this moment, digital health is not treated as a little topic by everyone, but the government say that as digital health is already transforming everything, we need to think globally about what's the impact of the digital health. So there was a first roadmaps and another one which begins few months ago. And to power these roadmaps, we got two financial plans. And the first one is called Secure for Health, with 2 billion euros to modernize the digital health information system. And the second one, which is called Digital Health Acceleration Strategy, which is more dedicated to the innovation system. Just like to mention that we made a report on the first digital health roadmap that we have translated, and we also have translated the new the good roadmap. So please feel free to have a look about these two reports, and especially the first one, the facts, because I think it's a very good entry to discover what we're trying to do in France in few pages and very, very operational. So what are we doing with digital health training? First of all, it's important to define the three targets that we have there, of course, and the most important is the health professionals, the social workers, and the administrative staff. They are the person who are working every day in our health system, and it's important to improve for all of them. I really mean all of them, the digital skills. But we also have other targets, digital health experts, like computer sciences, lawyers, engineers. I don't really know the situation for you in Europe, as in France, and perhaps the same for you. We are lack of digital experts, and especially in health, but also with other system. And of course, and last but not least, the citizens, and especially the one who are more in difficulty with digital uses. But back to the health professional, it's more than 40 professionals and 3 million professionals in activity that represent almost 160,000 learners by year. And of course, we are trying to improve our digital skills for patient care, but also to improve collaboration with professionals and to secure patient care. We have in France more and more often cyber attacks in hospitals, and most of the time the entry of cyber attacks is bad use by a professional of the information system. And of course, the idea is not just put the digital skills for the day-to-day, but also to try to prepare for the future methods. And of course, we all thinking about artificial intelligence or telehealth or connected object, but we have to prepare already the students for what they will have in the few years in activity. So how do we do this? First, we define what is digital health and what are the competencies that we need to put in the full-time education. So we define 5 areas of competencies. So health data, cybersecurity, digital tools, communication, and telehealth. And then we split all these professions in blocks. So the blocks, depending of course, your job, but also your level of education. So we define a first block with a health professional in higher education, like doctor, pharmacist, nurse, midwife. And we define for this block framework, competency framework with 15 competencies. It's almost 30 hours of training that we have made mandatory in full-time education from 2024, which means that for all these the professional full-time education, they will have 30 hours of digital health training by 2024. Then we got another block. It's also the health professional, but in higher high school level studies or lower, such as carers, childcare auxiliaries. So we did the same thing. We define a competency framework based on the previous one, but smaller because it's study we are less important. It's only 12 competencies and 18 hours of training. And as you can see, we are trying now with the other groups of the social worker and the administrative personnel. So first stage is to define what we are working on and define some groups and define for every group a framework and made mandatory, the framework in full-time education. But because we are the state, we can also have the regulation aspect, but the financing one is very important. So we created a call for manifestation of interest, which is called Skills and Professions of the Future, with 122 million euros dedicated to universities and paramedical training institutions. The idea is to finance every French university and paramedical training institutions. We already have 19 universities that are laureate in 18 months. And we have 33 health universities in France, so we miss 14 of them, but we already know that they will participate in a call for manifestation in the next month. So I'm quite sure that next year we provide financing to all the universities and the paramedical training institution. But not only financing, we also create working group with the laureates, and the idea is to, of course, improve practicing and the framework, but to create synergies in university dedicated to the digital health training. And so by 2027, the objective is to put for 100% of learners digital health. So we, as I mentioned, we already begin by the high-level medical and paramedical, such as doctor, mathematics, odontology. So it will be mandatory for 2024, but then carers and childcare. And as we are already working on, we hope that by 2026 and 27, put mandatory education also for social workers, administrative staff, and all the last one, because there was always few information that is quite difficult, I mean, to take in the way, but we are working on it. Okay, so it's only for the I recognize it's only for full-time education. We also have a long lifetime education plan, which is more complex. I can mention, but if you have a question about it, we can talk later. Okay, thanks a lot.
Thank you, Mathieu. And I would like to apologize for the confusion. I think I must be very hungry. So lunch is only at 1 p.m.
No problem.
So we have another presentation from the Basque Country. Marisa, the floor is yours. And then I think we have a lot of time for all your questions.
Good morning. Okay, I am Marisa Merino. I am the general manager of one integrated healthcare organization in the Basque Country in Spain. And I am also a member of the board of directors of two national associations in Spain, the Signo Foundation and the Digital Health Association. And that's why I'm going to tell about our project along these years since 2018. So a little bit about the Basque Country. We are in the north of Spain. The population is 2.2 million. We have a public health system with universal coverage. The budget, the third part of the budget of the government is for health in our case. And as you can see here, the Department of Health is the responsible for the policy and regulation, public health, public health planning, insurance and finance. And then the providers are mainly the public bus health service. This is Osakidetza is the name. And there are some private health centers related with Osakidetza also. We are organized by integrated healthcare organizations. We are 13 integrated healthcare organizations. So in each one of them, we have in one area, the primary care, the specialized care, the hospital, all of them. And I am the general manager of one of them. In Osakidetza, we have everything is digitalized. So we don't have paper and we have one electronic health record. I mean, the spine of our system is the electronic health record. It's only one database. So every functionality, everything is inside the same database. So I mean, our professionals are used to use the everything digitalized. When we created the new integrated healthcare organization, we defined which were or what were the competencies for managers to lead the integrated care. So this were, and one of these was the digitalization in general. Interoperability, the electronic health record, the digital transformation, and so on. So back then, in 2018, I discovered the ICANOS initiative from the Basque government. This was for the citizens in the beginning, and it's based on the DigiComp. So this is the methodology for all the people, for citizens and for professionals. The base is the DIGICOM framework for the development of digital skills. There are some, well, as you know, as digital framework, there is an audit, so a test for self-diagnostic, individual and as group for organizations. Then you can analyze the personal digital profile versus professional digital profile. And so you can know the gaps and so organize the training. There, the ICANOS has a guidance to help to do the training, and there's also a certification for all the Basque Country. How can we do the professional profiles? We have or we create a group with experts and professionals and describe digital activities and key digital aspects of the task, specify technological solution what are using, and then associate digital activities with a required DigiComp competences level. And what's that for? To collect digital requirements of an occupation, a specific occupation, and to specify digital knowledge, skills, and attitudes that we need to train and to advance. So the ICANOS initiative from the Basque government has defined profiles for industry, for general profiles, some experts, and then we started to define the profiles for digital health. So then in 2018, we designed a project for this. It was at the beginning, we wanted to create a framework of digital competencies for health professionals in the Basque Country. And we wanted defined the profiles and then designed a questionnaire for self-assessment. We created a group with experts and professionals of nurses, doctors, midwives, and we were studying what were the main activities that we were doing with patients. It was, in general, the main activities were clinical information search and communication, information management tools, or content creation. And then the use of technology, what tools or what softwares or what programs. And after all of this, we decided that we wanted to develop 3 different profiles. One for clinical professionals, that's doctors, nurses, or another one for leaders, and this is clinical leaders or managers. And then another one from administratives. So we went always based in ICANOS initiative and the DigiComp framework. So we were seeing, for example, the first of them, browsing, searching, and filtering information. We had all of these activities about digital activity, and then the other one about information sources, and the last one specialized tools that we were using. And so we were defining each of the activities in that case, and then an objective. So for us, it's very important, this one, the browsing, this one. So we need the objective has to be C1. The level are just like the languages, A1, A2, well, you know us, and so on. And each item we were doing the same. Then after designing the profile, the specific profile, we created the questionnaire for each of them, and it was on the platform of Icanos. This is an online platform. Then when each person, each professional can do on the internet with a link the assessment, and after finishing the assessment, this is the report. So each one can see his own results and the objective that he has to be. So this is the result, and this is the objective. So each professional know how is his gap, and then the organization can be all together and know what is the gap of the organization. So in that time, I implanted in my organization this one. So we sent the link to all the professionals. And this is some of the results, so you can know. There is each item of the DigiComp framework and the results. There are the results of the professionals, and there is also the objective of each of the items. This is, I think, this is the professional, and that one is the leaders. And then we, in the organization, we could see the gaps. So we developed training, and a specific training for our organization. So we planned a very, very beautiful and training strategy for 2020. And then it was all for the curriculum of each person in our organization, in Osakidetza. So the training strategy in 2020, you know, the pandemic came, and this program was terrible. But in a year later, despite the pandemic, we made again the questionnaire. And this is, for example, you can see the results of the leaders 2020 and 2021. So despite the pandemic, the results are better, a little bit, but better. So another result, for example, this is these are the nurses. So here we can see that it's important this because here we can see that there is a gap because of the age of the nurses. There's a gap in information communication and content creation. So we have to do something specific for these people, these nurses, in that areas. There are examples. Then, in the pandemic, we thought that it was interesting this that we were doing in Basque Country. So we thought we could do for everything, for every people in Spain or out of Spain. So in the Digital Health Association, we have done the same. So I mean, we took the profiles and we did the same process again with another group of people from all over Spain, and we updated all the profiles of the questionnaires and so on. We put 2 weeks or so in Twitter the new links. And these are the results by Twitter. Methodology is nothing interesting, but it was the interest of people from all over the world saying this is interesting for me. And so we have introduced this methodology and these results in a lot of courses, universities, masters programs, and so on. And then in 2021, we thought that it was interesting to develop some specific profiles. And we developed with the Signo Foundation in Spain, the digital competences for directors in Spain, only directors, but from all space. And here are some results. Here are the results from all the directors. There are managers, general managers, medical directors, nurse directors, all of them. And then all of types of organization also, publics, privates. The quote is something like this. In Spain, is something like this in general. So the global results, the most of them have intermediate and high level of digital skills, and third of them are high, intermediate, high. So it's not so bad, but if you can see the, for example, for the directors, the information we cannot see in the slide there, but the information were very poor. So I am a general manager, so but if we don't manage the information, so it was. But another thing in this there were no differences in the level of competences according to age. Here, nothing. So it's always the same according to age or position of the manager or the type of the organization. We have also done, after all of the results, we have prepared some recommendations, for example, for training, a dialogue for training, or some keys for accreditation at the level of Spain, I mean. We have disseminated this knowledge along the years from congresses and masters and university and so on. And we have recently received 3 awards, the new Medical Economicus Award last year. And this year, the Avedis Donabedian Foundation Award. And in June, we were finalists in the European awards also. Now, ongoing projects. We are developing the digital competences in primary care professionals just now. This is a result from the systematic literature review that has been terrible. And we are also doing another project just now, but we, in Spain, I mean, but we are searching for what competences do we have to have in the future. I mean, with the disrupting technologies, what do we need? What will we need? And final, some findings. The digital professional profile establishes the level and describes the competencies required in an occupation following the framework, the DGCOM. It's a dynamic model which must evolve as technology, a new professional evolves. Career and professional development plans must include the acquisition of new digital subcompetencies that allow to progress in the profile of the occupation. The setup of profiles of an organization must be managed and updated as professional progress in their competences and the technology used in these occupations. And the profiles can and should be integrated into the people management model of each organization and used as a resource for performance evaluation. And that's all. So the time.
Thank you very much for the presentations, both to Marisa and Mathieu. I think we catched up on time. Thanks also for that. So we have a lot of time now for questions, either to Mathieu or to Marisa. Maybe we start with Katre and then Raluca and Paula. And let's collect a few, no? And then we answer.
Yes, thank you for the both presentations. It was very interesting to see how and where you have arrived. I have a question to Mathieu. You mentioned that you have planned to, or you have made the 30-hour training mandatory. Two questions around that. One is that how do you assure that this 30 hours is really in place? Meaning that if it's written in an act or it's said that it is mandatory, then what are the measures? How do you measure it? And then also, do you measure the training quality of the 30 hours? Meaning that how is this training, let's say, given to the professionals? Thank you.
Thanks. Very, very interesting and not so simple question. So we plan to control the mandatory by two ways. First, and I think maybe the simpler, it's, as I mentioned, we got a financing plan, but this financing plan, it's more than just providing finances to the universities. It also creates links between universities and us, because if they want all the finance that they ask, they have to make some reports about what they have done for the students. And of course, it's the first easiest thing to control that is because if they didn't give us the reports or the proof that they really have trained the students, they won't have the money back. And the second way to control this is we got local authorities. In French, it's called regional health agencies, ARS, which jobs is, and not only for digital health, but for all the training that have in universities and paramedical school, the jobs is to control that every schools respect and the frameworks of the nurse, doctors, and the pharmacists. And so we are working with all of them to, of course, for the first years, not to only control, but to prepare. I mean, the schools, the universities, to have heard about what the financing that we can provide, and of course, unfortunately, in the next years, perhaps if some universities or don't school do not have doing the good training, we can think about I don't know. I don't want to talk about the fault, but we can think about how we can help more universities to develop these trainings. And second question, it's a more difficult one. It's how can we control the quality of the training? And that's very difficult because in France, and perhaps the same for other countries, universities as the hand of the trainings, and it's very, very difficult to control all the training and the quality of the training that they're doing. So I can mention two ways. The first is the same for the financing, is because we are financing them and we have a link they have to give us some report about what they have done, but also we can have access to the courses. But there are 33 universities, there is more than 300 paramedical institutions, so it's quite difficult to control all of them about all the quality. It's quite simple for the report of how many students they had for, but the quality of every training is quite difficult. The second way is we also, as our colleague, more or less the same as a colleague from Basque Country made, said we developed assessment to confront a platform to like a certification, and which is accessible for all the universities and the paramedical training. The idea is, if they have the responsibilities to give courses, we nationally have developed a platform to as a harmonized assessment of the digital competencies, and so we can with this platform, which we should be online very soon, we could check not the training, but if the students have the good competencies. And if we notice that from a single university or another school, there is a lot of students that don't have the good competencies regarding to the other ones, perhaps we could make a focus dedicated to this one.
Thank you, Mathieu. It sounds like now it's not the students who are responsible for bad grades, but the universities. No, that's strange. Maybe we take Raluca and Paula together.
It works. Thank you very much, Marisa, for the presentation. Just a clarification, did I understand correctly that you have done the survey to all the medical, like doctors, nurses from the Basque Health Service? No, just samples.
Marisa, you can use the microphone.
Yeah. I did it in my organization. So we wanted to upscale to the rest of the Basque Country, but with the pandemic, it has been impossible. So now we are trying it to do, I don't know, this year or the next year. Now I am in another organization because I changed, and I am doing it in the new organization also the same.
Paula, you have a question?
Okay, my question is also for you. It's regarding the project that you explained with Signo Foundation in 2021. First of all, it's to ask, why did you decide to do this project just with the directors? And also if you found some explanation that when we are seeing the results of the directors, we can't find this digital gap on the ages, while when we had all the professionals, we have seen that the age is really important regarding the digitalization.
The Signo Foundation is made up by a lot of managers, not only directors, clinical managers, and in general. So we were in the pandemic, 2021, and we have a big problem in general in Spain. And we thought that the directors have to lead the after pandemic, so in general. And we thought that the digital competences were key, and that it was very important to tell. No, it would be important that the directors were aware of this, of the importance of the digital competences. So we said, we have to insist with the directors. So we can do a questionnaire about this. And we did a group first with them, with some of them. So we developed the profile, and then we made the questionnaire. And the thing of the age, it was something curious because in general, with the health professionals, normally there is a gap with the age, but in the directors there was not. But it's different when you do a questionnaire for leaders and for health professionals. The leaders have to have another objective higher, and the results are better and a little bit different. And with the directors, it was something curious because it was not, we didn't expect that one, but it was like this in every, I mean, probably the leaders are something different in general. So we all have to manage digital tools in every moment. So there was no different, nothing.
Thank you, Marisa. I'd like to bring in our online participants. Jana, are there any
Hey.
questions?
Hi, finally we have a question from the online audience, and it's from Bianca Popescu. And the question is for Ms. Merino, and it has to do with the type of involvement of the participants in the project and digital education. Is the involvement voluntary or mandatory?
The questionnaire, there are voluntary. For the project, there are voluntary. And for the questionnaire, there are voluntary also. It was a debate about it because in some administration in our country, it is not, it's mandatory. So they always said to me, why is not mandatory in your field? And I say, our field, healthcare, is different. So we can't, there are some things that we can't do mandatory to the health professionals. We have to convince to do it. So at the beginning, for me, it's more important that they answer the questionnaire, because it's, first of all, it's for them. Each one has his own results. So, but then I don't know the result of each of my health professionals, but I know the results in general. So it's for me very important because I can organize the training depending on the needs of the professionals in general, not because you nurse of this place, you don't know, I don't know what. I want that the professionals can fill the questionnaire with truth. I mean, we don't know, the general manager will know what if I know or if I don't know. So I know they tell the truth because it's for them. And then in general, I can see the results and organize the training for all of them.
Thank you.
I have a question. So regarding the institution where you developed these digital upskillings, what were the financing instruments that you had, and what was the budget, and how many professionals were finally reached? Just to know number of resources.
We don't know any budget. We didn't know any budgets for any of the projects. No, we were always voluntary people, and in my organization, and then in Signo Foundation or in Digital Health Association, we are all voluntary. So we did all with no budget. No. And what is the other one? The other question?
No, the number of professionals.
The number of
reached and
professionals.
the budget, yeah.
There were, for me, it's one big and large project, but there are some different projects. So in every step of the project, there was different people. So in my organization, for example, 20 people more or less 20 people with administrative doctors, nurses, managers, and 20 people. But then with after this, I sent the results to other people to validate. So to other people from outside the Basque Country. So another 20, more or less. But then with the Digital Health Association, another 10, 15, but different from the start, and from all the regions on all Spain. And from Signo, the same, other different people. So in every step of the project, there are more different people that are updating the profiles and saying, okay, I mean, different perspectives depending on the region or the profiles or so in every step, more or less. And when we did from the Digital Health Association, for example, this profile, in other regions in Spain, in Cantabria, they used that tool to make a questionnaire for all the health professionals in Cantabria, and they use also to do the training in the area. So a lot of people.
Thank you. We can take 2 more questions and then we go for lunch.
Yeah, thank you for the intriguing presentations. 2 questions for Ms. Merino. First one, you said it was voluntary for the participants to take part in the questionnaire. Did you have any incentives for them, or and if so, what kind of incentives were they? And the second one, about the methodology of the questionnaire, how did you formulate the questions so that you would remove any bias by the participant? For example, did you just ask about the different competencies from the DICOM, or did you formulate the questions so that the participant wouldn't understand which kind of competencies were evaluated by this specific question?
Marisa, just let's listen to Elisenda's question, and then maybe we can take all of them together.
Well, my question is for Mathieu. I think that you were saying that you have also a strategy regarding the life learning cycle of active health professionals. If you just could give us some highlights about this strategy.
Marisa, you want to start?
We have no incentives. So voluntary with incentives, but it's the daily work. So it's interesting for all of them, but no incentives, no. And we started, we were helped by the people of ICANOS from the Basque government. So the methodology. So we started with the DigiComp framework, and then with this scheme, we were saying, okay, in that item, what are our activities, our tools, so what are we using in this item, and in this one, and this one, and this one. And we will, with the help of ICANOS and with our health professionals, and then we send to validate to other people outside our country. So in the end, I think it was no bias. I don't know, no bias, but I think after so many people participating, the bias has to be, I hope, no so big, I think.
Thank you. And Mathieu, the last word is yours.
Yeah, thanks a lot. So for long lifetime education, as I mentioned, it's not so simple. For the problem is, let's take about a nurse. A nurse, every nurse in France have done a nurse school. I mean, and so it's quite easier for us to take all the nursing organization, for teacher and students, and to say, okay, what are the competencies that we need for digital health? We put the competencies and we financing them. But when a nurse is working, she can work for public employee in a public hospital. She can work in a private hospital. She can also work in a private small institution. She can be liberal, and depending on who and in which institution she's working on, it's not the same the organization that control the long life education. And moreover, and of course, and it depends on the volunteer of the worker. I mean, if a nurse doesn't want to be trained or for digital health, we cannot force them. I mean, we don't have the power, I mean, to put monetary for long lifetime education. So first of all, what we are trying to do is for all organizations which are collecting and control the long lifetime education, we are putting digital health training, which means that the idea is by 20 and 27, every professional if they want to, and independently of either working in public or private or is liberal, they will have access to a training financing. It doesn't mean that they will all do and they will have train for digital health, but if they want to, they can have a financing training course. And the second way, it's now to improve the demand. It's to work with all the professional, and so we are working with a professional organization that they can understand it's very important to improve the digital health skills, and they will, if it's possible, ask to the operator that I already mentioned, and to improve the offer for the digital health transformation.
Thank you, Mathieu, and thanks to Marisa also for your presentations. We have reached the end of the morning session. Thanks to all of you for your participation. Now it is time for lunch. It's served downstairs, so we have to all take the elevators. And then we meet again here at 2:15. And meeting ideally means that we can start at 2:15. Thanks a lot.
Un, deux. Un, deux. Bonjour à tous. Bon après-midi. Au Penta Hotel à Bruxelles. Et voilà. Un, deux, trois, quatre, cinq. Test.
Thank you.
Que no está conectado. Ah, sí. Okay, so I think that we can start. I hope that you were able to enjoy the lunch break. So now we have a few more presentations. So we will start with the Netherlands. I think it's going to be a very interesting presentation from what we have seen from the Good Practices report. So I just give the floor to Robin van Isperen.
Thank you very much and well pronounced my name. It's, in the Netherlands we say Van Iperen, but Van Isperen sounds nice as well. For me, the pleasure to wake you up after the lunch. I will do my best. In fact, I should have inserted some funny pictures in my presentations as the Romanian colleague did. I like them very much, but I did not do because I thought it was a serious meeting with no room for jokes. So nevertheless, I hope to keep your attention the coming 15 minutes. I will tell something about the Dutch approach. I saw that you have changed the title in the previous, where is that here? No. Hey, it's not going back. No. No. Oh, it's going wrong now.
Yeah, not here.
Ah, okay. Sorry. It's only these two.
Okay, this is to go on and this is going to go back.
Ah, okay. Sorry.
To go back, right?
Yeah, sorry.
Yeah.
Yeah.
Ah, yeah.
Ah, okay. Okay.
Huh?
Okay.
Yeah.
Sorry. I just said that the title was changed. I think they made this title of it. I think it's much more catchy. So we keep this title in our heads. because it's all about creating education and training pathways for the busy healthcare employees, professionals. So I will tell something about this. So this was my original title, which is rather boring, so let's forget that. Just a few words about me. I'm Rowan van Eijperen. I used to work for first the Ministry of Industry, working in innovation field. Then I moved to the Ministry of Education. And since 3 years, I work for the Ministry of Health, Welfare and Sports. First in the COVID crisis department, and now in the department dealing with the labor market issues. And in between, I also worked 3 years in Brussels at the European Commission, DG Education and Culture. So it's good to be back in Brussels. I really enjoy it. Just how I build up my presentation along 4 lines. First of all, I will say something about the need of urgency. Why is it needed to work in a different way in healthcare, in a more digital hybrid way, and thus why do we need to stimulate the digital skills? Then I will say something on the Dutch policy, because I'm a bureaucrat, or a nicer title is maybe policy advisor. So you will hear that also in my presentation. I will more give a presentation from a more strategic point of view. We have a more facilitating role, and I will go less into the content of the whole thing. So keep that in mind, maybe also when posing questions later on. I will mention a few good examples maybe you could learn from. And finally, some conclusions and lessons learned. Is it okay now or is it? Yeah, well, first of all, the need of urgency. Probably you recognize this in your country as well. I think the need of urgency has never been that high as nowadays. In the Netherlands, nowadays, on every 6 employees, 1 is working in the healthcare sector. And if we continue to organize our healthcare in the same way, in 2040, on every 4 employees, 1 will have to work in the healthcare sector. And it's clear that's not a way to go. So this urgency is very clear. And in fact, it also helps us to take action. So that's the good side of it. Because if we want to keep our good system with good quality, open access, and to keep it affordable, we really have to organize it differently and with less people. So solutions with less people. And we also have to educate it differently. And what I forgot to say, it's mainly on the shortage of personnel, but there's also a budget thing, because nowadays 13% of the national budget goes to healthcare. And if it's about 100 billion a year in the Netherlands only. And if we continue like this, it will be doubled in 2040. So that's a choice, money, but still it's an issue in the debate, of course. So we have to organize our work differently. We also have to educate differently. And I think there's a good reason for it. And the figure I mentioned here, I think, can also show the good side of it, that by technology, we could save more than 100 full-time employment and by making care easier and also by prevention. I also mentioned that we don't have to forget the human factor. Technology can do a lot, but the human factor stays always very important as well. We will save some time, but maybe some of that saved time we could use to have a talk with the patient, the time we don't have for it now. Also important to note is that when implementing every new technology, also the organization should go with it and should innovate. We call it social innovation. And important also to do it together with the people that have to work with the technology, mainly the people on the work floor. It's really vital to give them a voice, to co-decide and to really discuss with them what they need for the implementation of the new technologies, and also to show them what are the advantages, because they're not always clear for them. So need of urgency high, and I would say if we don't succeed to stimulate the digital skills now, we won't succeed ever. So it's now the time. What did we do in the Netherlands? As said, the urgency is shared by all stakeholders. Last year, we concluded a big, as we call it, integrated health agreement with all stakeholder organizations involved, led by the Minister of Health, my minister. And based on the assumption that we have to organize it differently and with less people available. That was the basic assumption all parties agreed on. In fact, this agreement, the big message of this agreement is that we have to make a transformation from the current system to a more, as we call it, tailor-made healthcare system, with also more room for hybrid healthcare. I don't know the term tailor-made, suitable, or personalized healthcare. But some characteristics of this is that it's more oriented on what a patient still can, and not on what he or she can't anymore. So it's also more on prevention. It's more on discussing between the healthcare employee and the patient together what is the best treatment. It's also very much about working together over disciplines, to really make a good analysis of what's the problem and what's the best treatment. There's also, I forgot one, there's also an active share of proven technologies, because sometimes it's also better, for example, to not do a treatment, to say, okay, it's better to recover a few days at home instead of in the hospital. So it's really in dialogue with the patient, to do only the, let's say, necessary healthcare. For that, we also need a good information sharing system. It was called already this morning. The exchange of data is a huge project. In fact, we have a national strategy on it. The horizon is 2035. Where the first step is for the coming 3 years, and it's very much on the interconnectivity, interoperability of systems. And luckily, there's also some budget going with it. It's 1 billion, which is quite a lot. But it's also a huge project if we will succeed in it. So these are some characteristics of that transition or movement we want to succeed with the agreement. We hope that the effects will be very positive of this personalized or tailor-made healthcare. Some is that we think we can deliver better quality. We also think that the cost will rise not that fast as they do now. I think we can also avoid over-treatment or over-research. And also very important, it hopefully will also be time-consuming or saving for the health care employee, which will add to the pleasure of work. So these are some assumptions where this agreement is based on, where all parties involved do agree on. I think that's very important, because before everyone was discussing from its own sector, and it's more about the money, and now they have a kind of general common goal. More on the instrumental level, we focus on scaling up proven time and labor-saving new technologies. I mentioned some examples, but there are a lot. We support the healthcare institutions. I will say something about it when pointing out some good examples. Sharing good practice, but because the system in the Netherlands is that it's really up to the sector itself to implement it. It's very bottom up. It was said before, I think, by the Basque delegate. It's not a sector where you can impose things. It's not working. So we're really facilitating, and the sector should really do it. But we can help with the implementation, and we can share good practices. Luckily, there's also funding. It's a big bag of money, up to 2.8 billion. That's for the whole transformation system step we have to make. And part of it will also go to new technologies, the new way of working and new way of education. I have not the exact figures. I think it will also depend on the plans that will be delivered by the sector, how much money is going to what theme exactly. But that's part of that money. We facilitate the cooperation between the different stakeholders. We have to do it together, the so-called knowledge triangle. I think that's a term in the European context that is used a lot. You need everyone to do the job, educators, healthcare institutions, governments, and maybe also private parties. And then, of course, also part of the agreement is that we have to secure the digital skills, and that's the theme of today. So it's a bit long introduction, but I now will. No, I go back. Yeah. And what is said in the health agreement, you can read with me, but the most important is that already by the end of next year, in the education, function and professional profiles, the digital skills have to be inserted as part of the skills that suit to the changing healthcare demands and the need to work differently. So I think that's a good thing that it's put in the agreement signed by all stakeholders. So that's the starting point, and now we have to do the work. I would say negotiations are already going on in the vet sector, how to do it. Personally, I think it's not too problematic to insert digital skills, both in vet and higher education. 10 minutes to go, perfect. Maybe there's a discussion if it would be in the optional part of the curriculum or in the more obligatory part. Of course, we prefer the last one. But as said, we have no direct role as a government. We're really facilitating the debate. And in the Netherlands, it's really up to the education institutions, the branch organizations, and the working field to come up together with new skills for the curriculum. So I think we will succeed to have this all in the profiles end of next year. But then I think even more the question is how to get the people get trained. And then I'm especially focusing on the lifelong learning part and the current healthcare employees. Because what we found out is there's quite a reluctance to get trained in digital skills. You also see the figure that almost 2/3 of the current employees think their digital skills are not good enough. And what we find out is that, for example, when you offer central trainings in groups, that people are afraid to admit in a group that their skills are very low, so they don't come to the training. So we have this initiative, Digivaardig in de Zorg. If you translate it, it is like digital skills in healthcare. It's partly funded by the ministry, but also partly by the education sector and the healthcare sector. And they do several things. They help the employees to get confidence in how to learn the digital skills. They also try to convince them or let them see how useful new technologies could be. They can do self-assessments. They can help organizations with the implementations. They organize meetings. They have learning materials freely available. They train teachers. So all these kind of activities that are needed to get it a success are done by this networking organization. And I think especially the DigiCoach is a nice example. In fact, that is a healthcare employee that is trained as a DigiCoach, and that is helping direct colleagues with ICT or digital issues. So it's really a one-on-one approach. And what I heard from this organization is that it's very effective and taking away a lot of barriers to employees to get into the digital world. So I think it's a good example. And another example is Dutch, which stands for Digital United Training Concepts for Healthcare. And that is, I think it's interesting because we have a lot of education places for medical professions, but they're not filled because all people are taken. Students, the current employees who want to study lifelong learning, they are taken by work, but especially also the supervisors that are needed. There's a lack of supervisors, so we can't educate enough people. And by replacing part of the practical part by simulation, digital simulation, we need less supervisors, and we can educate more people and also faster, which is good because there's a shortage in a lot of professions. And at the same time, it's not really lowering the quality of the education, because with digital and simulation, you can also simulate real life cases and also use new technologies. And that's also a very good side of it, that by making it more modern and by using more digital technology in it, students already get used to new technology, so they're more or less already prepared to use them when they work. So I think that's a good example as well. Then to conclude, they are quite general, but first of all, there's a need of urgency, and that really helps to get the noses in the same direction, which was really not the case before. Everyone going for its own pillar, just asking for money, let's say. And now it's more the same direction. I think it's very important that you bring together all stakeholders involved. As said, they have to do the job together, especially education and work field. They really should work together from the beginning and not be two camps aside. I think that works quite well in the Netherlands as well. And for the role of the government, I think we still can have an important facilitating role. First of all, sometimes we could really be quite directive or give a direction to the discussion, see the agreement, for example. We can reduce barriers, for example, by stimulating this electronic data exchange system. And we can bring together parties, and of course also the funding helps to get things off the ground. So I think that's what I wanted to tell you, and I'm still in the time. Yeah, thank you.
Okay, so before going to the next presentations, we can have the round of questions, if you have some. After lunch is more difficult.
Still, the after lunch. Otherwise.
Okay, welcome.
Thank you for the presentation. I would like to ask quite a broad question. It's about which aspect you had found most challenging in trying to implement digital skills in the health field.
I think we're still in it, but the people have to do it. So it's a transition process, a change process. It has been said before. So it will take some time to really get everyone so far. So I think that's the most challenging part of it. I think the money is not a problem. Content is not a problem. I think we know where we go, but yeah, everyone has to go with it. So I think that's the most challenging part.
Thank you, and that seems to be the common challenge from
Yeah.
as well.
Yeah.
It's really getting the people to move into that direction.
Yeah.
Just a commentary regarding your presentation, because often in the rankings, so we see that Netherlands, it's positioned as one of the top leaders in the area of digitization and also in digital health. So it is somehow curious that you face also that challenges on bridging the gap on digital skills for the healthcare professionals. It is just a comment. And the question is, do you feel that the lack of digital skills is more on the level of the basic skills. So that was, or it is the strategy that in Catalonia and Estonia, it is being developed, or we are talking already on a gap on, I don't know, advanced and skills and on emerging technologies skills?
I think it's both. And it depends on the profession, but sometimes it's very basic, writing a normal email, for example. And sometimes it's really far end with new technologies in certain professions, how to deal with them. That part is better and better covered, but even if we have good universities, it's still very conservative, especially from the profession. It's often said that, yeah, technology, simulation, yeah, are we just learning a trick, or is the quality good enough? Because of that debate, it goes slower than what we have already in place and could use. So, yeah.
So I think that perhaps Jana has a question.
Yes, hello. We have a question from an online participant, Miss Kalechi Elia. Again, I apologize if I'm mispronouncing the name. So the question is regarding the DG coach. Are the DG coaches actually healthcare professionals? Since early on Ikanos shared their project, it was developed thanks to a voluntary participation. Have the circumstances been similar in the Dutch project as well?
As I understood it, the question is if the DigiCoach is a healthcare employee. The answer is yes.
Yes, and is the participation voluntary as well?
Yeah, in healthcare, everything is voluntary. But the good thing is that because it's a current or someone already working in healthcare, that they know best the questions of their colleagues and they know best how to help them. So that's, I think, the strong point of this DigiCoach is really someone already working in the sector and in practice. Yeah.
Thank you for your answer.
Okay, thank you for the question.
Thank you so much.
Yeah, okay.
So now it is the next block is on presenting EU initiatives on the field of health-related digital skills. So we'll start by the Be Well initiatives, and I call Giorgio Valiotis from the European Health Management Association to come. Hello.
Hi, everyone. Thank you so much for having me today. I'm George Valiotis. I'm the Executive Director of the European Health Management Association, and I'm going to talk to you about the Be Well initiative. So my focus for today is going to be on digital competencies for healthcare professionals. Has anyone here, and don't worry if there's no hands, but who's heard of the Be Well project? Okay, this is good. This is encouraging. Okay. So I'm going to tell you a bit about what the project is, how it came about, and specifically how we want to work with regions, with countries, and across the European Union. It's a 4-year project, and I'll walk you through where we're up to and then what the opportunities are. There's a lot of technical phrases in it, so you'll have to bear with me, and if you want me to clarify any of it, then I can do that. So feel free at any point to give me a sign that says, wait a minute, this isn't making sense. Now, the purpose of the Be Well project is that we want to prepare the health and care workforce and the ecosystem to tackle existing and future challenges and to adapt to the ever-changing societal context. But also we want it to be more competitive in a highly demanding and rapidly changing labour market. Now, what's interesting about this project is it's not just happening in health. The exact same project is happening in fisheries, car manufacturing, communications, in all of the ecosystems across the European Union. So it's being funded by Erasmus Plus in that way. And it means it really forces us to think very differently of not just the same old stories, the same old ways that we know health, but what's happening across all of Europe, and then thinking of Europe as a as an entity globally of how do we keep up? How do we make sure that Europe remains a leader, that Europe remains able to have the skills, the knowledge, and the products that we need to ensure that we provide our citizens with outstanding health? And so it's fun to go to these meetings. I go to them like every couple of months with aeronautical engineering and defense and hear their same challenges about recruiting people around digital skills and green skills. So that's, for me, is an important thing to know. Our consortium has brought together 24 full partners and also 5 associated partners across 11 countries, but it's just our starting point. And we want this work to benefit everybody. You can see here, and you will also see it if you can see the website bewellproject.eu, that you can see all this information there. But the partners represent several key groups. We've got the education institutions because we need them to educate people about these digital and green skills. We've got the research organizations to make sure that what we're doing is evidence-based. We have the labor market actors. So that includes organizations like the European Federation of Nurses, the European Specialist Nurses Organization, the primary care doctors. We've got all the professions involved. We also have the unions involved because we understand the complexity of asking people to work differently and bring up different skills, that these will have labor union issues. And so they've been really actively involved. And then we have several NGOs that work with digital competencies, that work, NGOs like the European Health Management Association. So it's a very good mix of all the right players. So we are leading the development of the work to get things started well, and then working extensively in consultation. So the demand for this work is driven by 6 different policy drivers. It was great to hear the previous speaker talk about lifelong learning. So that's one of the really important drivers of this project, is seeing this as not just a labor challenge, but we want to care about our people. We want our people to stay in these jobs. We want our people to have really good work experiences. And for that reason, that's one of the drivers. I won't go into the policy drivers otherwise too much, but I put it here for you because I appreciate some of you might be really quite engaged in some of these. So I'm putting it there as a prompt and to reassure you that across the European Union, these really are the strong drivers. COVID recovery, what else? Sustainable competitiveness and the Green Deal, and then the industrial strategy as well. So you can see it's lots of factors. So let's talk a bit more about what exactly is the Be Well project. So the first part, so in the top right, is this a pointer? It is. So it's online. I don't know if you can see my pointer, but I'm pointing to the first top left. So developing skills intelligence on the digital and green skills. So this is Novell. This is a WHO Observatory on Health and Health Systems. They've really looked at how do we, what is already out there? And I'll show you a few things that they found so far. With a sense of the evidence base, we're also then launching a large-scale skills partnership under the Pact for Skills. So these are some of the technical terms. I'll tell you more about the Pact for Skills in a moment and the large-scale partnership. But what it basically means is there's no point in doing this if we don't involve everybody. So we need to create opportunities for everyone to join these networks and these groups in a way that also adds value to the many other networks and groups that already exist. So that's the large-scale partnership, the Pact for Skills. Then we have developing and implementing a pilot training program on digital and green skills. And so the education institutes are creating new occupations. They're then piloting them. So that's the University of Thessaly in Greece, my home country. So they're piloting them and testing out in a real world setting, how do these work, learning from them. And then all together, the evidence, the networking and all the consulting we're doing, the strategy that we are building, the piloting, the education programs, all feed in to the final kind of key deliverable, which is the blueprint or the skills strategy. So the skills strategy is going to be one of those really lovely little booklets that we see very regularly, but we want to make sure that when you receive it, you're like, yes, this helps me. We want to see cross-border collaborations, and it's great to see everyone here in the room that can help contribute to that. Lifelong learning is a key driver of the strategy. We want to raise the awareness about the advantages of the uptake of green and digital skills. And we also want to create tools for policymakers. So around how we can fund this work and what other policy drivers we can do to make this really happen. because this is like, for me, green skills in the environment is a very good example of a topic where nobody would disagree. These are really important things. But then practically, how do we actually roll them out in these really complex systems that have such differences across Europe? That's the challenges that we want to learn more about in consultation, and therefore create mechanisms, create guidance in the strategy that actually gives you some tools to bring the changes that you need in your settings. The skills strategy has 6 key objectives. They're hard to read from any perspective, but it's also already available online. So if you just go to the Be Well website or Google Be Well project, you'll find the first draft of the strategy. Now, with or without my glasses, I can't see it, but I can tell you it's things like that health and care workers have skills to address the mismatches and advance the transfer of knowledge. The second objective is enhancing and promoting adequate levels of digital literacy. We've done that separately from the third one of adequate levels of green literacy, because we realize we can't marry them. We need digital as one point and green as another point, and we have to look at them both, but separately, even though they do cross over quite a bit. I mean, digital has a big energy footprint. So those are 2 points, 2 and 3. Number 4 is strengthening the promotion of soft skills, because what we're learning in our consultations is it doesn't matter how good your green skills or your digital skills are, we need better communication across healthcare, better patient engagement. And without these things, that's how we make the maximum use of digital skills, essentially. So that's number 4. Number 5 is promoting the physical and mental health and well-being of the health and care workforce. With all of the labour market drivers, all of the health professionals that are involved in our project, they keep saying to us, there's too much pressure on us, far too much, asking for another thing. We appreciate the other thing, we appreciate digital and green, but unless you make our lives a bit easier, when will we find the time or the energy for this? So objective 5 is a fundamental driver for us on ensuring that that's taken care of. And number 5 is advancing their curriculum. So making sure that our universities, our vocational education and training providers are delivering the right courses, but also that our teachers have these future skills that are needed to pass them on. I'll go through the next slides quite quickly. For health and care professionals, we want to see benefits such as their lifelong learning, high quality impact on their well-being, and then reducing their administrative workload and letting them make better decisions. For patients, we want to make sure that care is patient-centered, that it's value-based, it improves long-term care. We want patients to be empowered. So we want the outcomes of this to achieve those things. And at a system level, we want better health and outcomes and better processes overall. We're mindful of inequalities. So as we introduce these technologies, we're mindful of things like digital literacy so that we overcome those. And we want to make sure that we integrate it into the health and care workforce's needs and not create just another challenge. So to build the strategy, I talked a little bit about this. We're mapping the needs of people. We're identifying new and emerging occupations. I'm going to show you them next. We're developing new skills to cope with future challenges and changes. And we're also wanting to be mindful in the strategy and create some guidance on that about the shortages of the workforce. Medical deserts is a key thing that's come up, and gender equity. We want to improve quality of care and professional development of health and care workforce. So looking after them is very important, as I keep repeating. And then making sure, like the last point, of mitigating the tension between skills education and technology development. Now, by that, I mean, technology is changing rapidly. So how do we pick the right skills to give to people now that don't get outdated? And in that way, we're looking more broadly at generally raising the overall digital literacy of people so that as new technologies come in, people are more able to have a starting point with which to engage in that conversation, rather than thinking, I have no idea what this new technology is or where to start. I'll go just now onto some of the key things. So what we identified in a previous piece of work under the European Health Policy Platform was that the key ideas are digital and artificial intelligence skills. You see again the communication skills for patient-centered care and interdisciplinary skills. So integrated care is another key driver, as well as green skills. Why we need these skills, I think, has been well established by the previous speech. And then, so what are some of the new skills? I'm just giving you a small handful. These things came from the Joint Action Group, and they also come from the McKinsey report. But I'm going to tell you about new medical roles, new technical medical roles, and future-oriented medical roles. I won't tell you all of them. It's just a couple of things I'm going to pull out. So for some of the medical roles, we're looking at care coordination. We're looking at peer roles, disease management, navigation. So navigation being specialized registered personal advocate and can help you navigate a treatment process. We're looking at patient education. We're looking at behavioral health professionals. So these people working with behavior health and patients and practitioners, and then clinical informatics. We're also looking at technical medical roles. So medical scribes, ICT health trainer who would educate and train ICT professionals and potentially to reach predefined standards of ICT technical competencies. Things like biomedical software engineers. These are roles we'll see a lot in technical medical roles. And I'm telling you about these to understand the full landscape rather than just a particular department. The third category will be future-oriented, just medical roles. So things that are coming up in these reports are bioprinting experts, climate change specialists, medical cannabis science and business could be another example that's emerging. So that's just a snapshot of them. What's most important for me is really just how much your voice matters. Now, already we've started the informal consulting process, and that we're consulting on the process, we're consulting on the overall structure, we're consulting on those objectives I showed you. The actual roles, we're not consulting on those roles, they come from the evidence, but as we're consulting, we're hearing about what are the needs that the different health systems have for particular roles. And oh, I see questions popping up. I'm sure they'll be read out later. And so we're doing an open online public consultation to validate this strategy. And we're going to start that in January of next year. And we'll be doing that in 8 languages, which will be the 8 languages of the project partners. And so that's a chance to really speak to it, because we want this. So if you're watching this today and you're thinking, oh, it's good, but wonderful. Those are the things we want to hear. But what? What could we do? What else should we be factoring so that we can give you a strategy that works for you? The other point is, so this is another one of those technical words, is we have a large-scale partnership, which is under the Pact for Skills. The Pact for Skills is a European Commission thing. Has anyone heard of the Pact for Skills? A few of you have. Yeah, okay. I think it's some of the same hands of who've heard of Be Well. So the Pact for Skills is really just a European Commission movement to make sure that to enable the right group of people to come together and say, yes, we are making a pact that we are going to upskill and reskill our people. It's that important for us. So we're doing the one on health. One of the main things is point 3, so that we can monitor skill supply, demand, and anticipate skill needs. But we also want people to really commit to supporting their workforce to get involved in this training. And we're at that point where we want to say, we've been talking about this a long time, and it's great and it's important, no one questions that, but we need to really start to implement this now. And we need to do it because of the well-being of our workforce. We need them to know that they have our support and encouragement and these skills that will make their life easier. But as you know well, that's not going to be an easy bit to step into, because it requires an initial real investment. We want it, as I said, to benefit every level. And what we also want people to do is to commit to doing that. We want to involve people. We want the people who commit to involve all of their stakeholders as well. We also want to see models of how financing can be secured. I don't have the answers for that today, but we hope that will come out in our consulting process. And then obviously implementation is the other key focus. And I was delighted to see a lot of the people in the room today who I know from your regions and from your countries have some really amazing examples of implementation. And then finally, in summary, we've got 3 parts. So there's the Be Well Partnership, which is the consortium partners that I showed on the first few slides. They're going to keep till the end of this year consulting with our own close networks on how to improve the strategy. That will then help us get the questions right on how we consult more broadly. That will open in January 2024. And then the public consultation will go far. Don't forget the Pact for Skills. That's also on the website for Be Well. And I know right now I can see people on their laptops. I can see they're literally Googling Be Well project. So thank you for doing that. And when you find that, you'll see the Pact for Skills and you'll see where you can follow it on social media and get more connected. That's my speech. Thank you very much for having me today.
Yes. Thank you so much, George. It was very interesting. So now we are going to leave the floor to the EDL project. So we are going to have a remote connection. I hope that Marta Pisano and also Ines Ray are already connected. Yes, they are. So welcome and thanks for joining. So you can start the presentation. Thank you.
Thank you very much. Just a technical issue. I share my screen or you share my presentation?
We are sharing your presentation. Do you see it?
I try to, I know. Okay. So thank you very much. Good morning. First of all, I would like to thank to the DG for to invite us to participate in this very, very interesting workshop. Next, please. The objective of my colleague Ines' speech today is to talk about the general framework of the strategy and the ideal project. The context of the European strategy will develop in the framework, and I'm going to give you what idea the project look like, no? Ideal acronym is Improve Digital Empowerment for Active Healthy Living. This project has received funding from the European Union and has 2 years the duration and will end in March 2024. It involves 14 partners for 10 European countries, coordinating by from Asturias, Spain. Next, please. This project is a coordination and support action that was present to this topic. It's very interesting to focus on this topic because it's supporting digital empowerment and health literacy of citizens. Now, to carry out actions and different strategies, center people approach. And the premise of the topic that is very interesting too is assumption that, excuse me, you can hear me well? Yes. It's assumption that the people get more education, more motivation, and increasingly empowerment citizens to use digital tools. The citizens can monitor and use technology to improve their physical and mental health. And the citizens are increasingly more autonomous. This is the premise of the topic. Next, please. And the main objectives of ideal project is developing and testing new models and approach on digital health literacy intervention, develop an application through the co-creation on a comprehensive, inclusive digital strategy. This is very important that already mentioned that the co-creation activities is involve people in our project. That is a very interesting point. The specific objectives of ideal strategy are formulate policy to promote, recommend testing and monitoring digital health literacy levels, focus the strategy in 2 targets, citizens and also professionals, health professionals. And the third objective is to develop activities to improve health literacy and achieve good health literacy, of course. What value propose that ideal content, no? A robust consortium will represent very diversity entities for 10 European countries with the same objective, that units health and digital transformation with a strong focus in social innovation and co-creation approach, taking into account, of course, gender, inclusion, ethics, and privacy.
And the ultimate value is ability to engage policymakers and stakeholders in this new European strategy. Our expected impacts or benefits are, on the one hand, to help citizens to have better quality of life and healthy by adopting digital technology, and on the other hand, involve policymakers and stakeholders to promote an inclusive and effective strategy for all. And next, please. What have we done so far? First of all, an analysis of what disease what was carried out with a very detailed analysis of scientific documentation review, literature, European strategies, and different activities in 3 different steps. The first one is was analyze the general health literacy and digital health literacy. The second one was analyze a selection of best practice related to digital health literacy. And the third one is a deep analysis about monitoring and evaluation digital health literacy approach. So you can see in the screen the numbers, no, and to give you a intensive work what has been done in IDEAL, coordinated by the University of Denmark and our partner in Finland. With this, all the information in Work Package 1, we focus the scale that measure the literature levels and create an interactive map is made. No, you can see only the fixed picture in the screen. The global atlas of literacy in health, and you can move an interactive with different levels and Europe and beyond related to the digital health literacy levels. Next step. And also we can see the map and link the map through our web page. Next, please. Another important milestone in the project has been creation, coordination, and implementation co-creation activities in order to involve and meet the needs and proposals of different citizens and groups. After the very also intensive work, finally we had 140 sessions with 19 different targets groups, and we finally involved 1,434 participants. Next, please. As you can see on the screen also, we involve elderly people, migrants, young people, pregnant and young women, formal and informal caregivers, policymakers, experts in digital health literacy, low-income citizens, health professionals, people who live in prisons, health students, and children's groups. You can see some of a very high number of for our co-creation carried out with various qualitative approach and methodologies that have captured all the diversity and richness of every target group. And now let's up the work done, the first version of the IDEAL digital health literacy strategy last June. Incorporate the lesson learned from the review and mapping carry out, and the conclusion draw for a workshop held by 22 champions related to health literacy, digital health literacy, sorry, and incorporate the first version of an ethics, gender, and privacy toolkit, including a very good contribution with 8 ethics experts, 7 experts in inclusion, and 9 experts in gender. For the second version of the strategy in September this year, last month, the result of training, we incorporate all the results made in the co-creation activities. Next, please. And also we add a specific set of indicators to monitoring and evaluating different activities and approach or strategies related to digital health literacy. The final version of the strategy, which we will be complete in October, incorporate the second version of the ethics, privacy, and gender toolkit, and the conclusion of a workshop with other European unions, and also the last contribution of our advisory board and our panels expert in digital health literacy. So this strategy has the vision or the mission to empower health literacy citizens and use digital technologies to create more well-being, of course, and more high quality of life. So thank you very much. I give my floor to my colleague Ines, who will be present the specific content on this strategy. Ines, let's go, please.
Hello. I don't know if you can hear me.
Yes.
Yeah. Okay. Hello to everybody. My name is Ines Rey. I'm a member of the coordination team. Thank you very much to the DG Reform for the invitation to this workshop. I will present the content of the European Digital Health Literacy Strategy we are working on in the framework of the IDEAL project. As Marta said, it is still a working document. The final version is under preparation and it is expected to be sent to the European Commission by the end of October. Here on the screen, you have an overview of the entire approach and the main variables considered to build the strategy. Next, please. The key points are the ones that you see here circled in red. These two blocks, the digital and the health information components. The health information components, next please. The health information components, well, for you to have a better understanding, come from the framework given by the World Health Organization that includes access to information, understanding of the information, critical appraisal of the information, and application of the information. On the other side, we have the digital components that come from the framework given by the International Telecommunications Union. So you can see those here: training and skills development, content and curriculum, evaluation and monitoring, and policy and strategy. Next, please. So this big core also interacts with a second layer, which includes two blocks. Next, please. This second layer interacts and modifies the core framework mentioned before and refers to three different levels, which are levels of action, and also refers to interacts with health dimensions. Why this second layer? On one hand, the health dimensions were a requirement by the European Commission, so the European Commission wanted from the very beginning of the project that the strategy focuses on how or interacts with these four dimensions that are self-care, health promotion, disease prevention, and healthcare and treatment, and work on three different levels. The micro level, which means that the action will focus on citizens, patients, families, and health and social workforce. Also the meso level, which refers to the institutional level, healthcare and social organizations, and the macro level, which refers to the policy level, governments and European and international institutions. Next, please. So regarding the document itself, the strategy, you can find the information mentioned and also some recommendations and key ideas for the effective implementation of the digital health literacy strategy in a territory, in a region, or in a country. Next, please. And finally, also very important to mention that this scheme also interacts with 9 additional components, which we have called transversal components, transversal elements. Next, please. And the inclusion of these 9 elements comes from our experience and also from a toolkit that Marta mentioned before on gender and ethics, privacy and inclusion aspects that we have developed within the project, for which we have received support from different experts in the fields at the European level. These components are applicable to all the layers of the strategy that are accessibility, cooperation, work for getting effective digital health solutions, equal opportunities for those at risk of exclusion in digital health literacy, ethics and privacy, gender differences and gender promotion, inclusion to ensure the participation of all the citizens, regardless their age, their sex, ethnicity, geography, or level of income, wide participation involving the end users and the local communities considering the social determinants, and long-term continuity and impact for sustainability. Next, please. And finally, just to mention that the strategy includes also a monitoring approach to evaluate the activities implemented. Next, please. So different levels of evaluation and indicators are proposed to interact with the different levels of the strategy mentioned before, the micro, the meso, and the macro level. Quality, efficiency, effectiveness, process indicators, indicators to measure the impact, the sustainability. And that's all from our side. This is a very broad approach of the strategy. We do not have much time to go into detailed information, but the strategy includes very specific tips and recommendations which may be very useful to get an effective implementation in the regions and countries. We will be glad to share with anyone that is interested the final version of the strategy that is that, as we have said, will be ready by the end of October. And yes, please let us know if you are interested in receiving the document. And that's all. If anyone have any question, please go ahead.
So thanks so much, Ines and Marta. Very good presentation, and I'm sure that we are all willing to see the strategy. So please, we would like to, when you have it, share it with us. And so now I give the floor to the round of questions and answers. So we had the presentation from George and also now from Marta Pizarro and Ines Rey. So if there are some questions here in the table or also online, please go ahead.
I'm all the way up. That means someone has to ask something.
Yeah. Okay, so I have a question, George. So regarding, I've seen that one of the areas that you were focusing on was to identify and plan the need for resources taking into account the supply versus the demand. So how are you planning to do this exactly? Because it is going to be a very complex exercise, I imagine, to do. And I would also need to ask, it is going this to happen at the European level or just for the 11 countries that are within the project?
Thanks for your question. So the strategic plan is targeting all 27 EU member states of the European Union. And we wanted to look at regional, national, and European level. And the reason for that is, it's funded by the European Commission to benefit all of our citizens and all of our workforce. So it has to be everybody. The reason we're looking at the different levels is obviously healthcare is organized differently in different settings. And so depending on where we can make the best impact will be either a region or a nation. Of course, it'll also have some impact on the European Union. And although health is really the responsibility of our individual member states, I talked a bit about COVID being and COVID recovery and resilience being one of the drivers, meaning we need European Union policy drivers to help us in that. But we also need better investments, and that investment could come locally or it could come from Europe. Your other question was about supply and demand. You're talking about the workforce and such a tough issue, and we don't have the answers yet. We want this project to help us find some answers. We're also involved in other projects like the Joint Action on Heroes. I'm sure many of you are, I know many of you, such as our colleague from Estonia, is certainly part of that. I've seen some of you at those meetings. So we can't expect to answer everything in the Be Well project. The Be Well project's going to address that slice on a strategy on how do we upskill and reskill in digital. In order to do that, as you're asking, we need to address other things. That's beyond our scope, but we're collaborating with other people doing these other projects. And it's not just Joint Action on Heroes, it's also a whole bunch of the joint action, the action grants that the Commission did last year. They had about 20 million euros on education and training initiatives. No doubt some of you, or at least your regions and countries, are involved in that. So we want to consult. So it's the consultation that's going to give us those answers.
Okay, thank you so much. Any other question? Yes.
Thanks, George. I'm wondering, I mean, your approach is slightly different from our approach. No, we work like with the governments in member states or regions, whereas you work with the stakeholders more like on the ground, like research institutions, social partners, and so on. And we're all addressing the same challenge. Like how do you make sure that what you do reaches policymakers and the other way around? No, I mean, okay, this workshop is one example of raising awareness, but how do you do it like in the context of B-World?
So the other things that we're doing in our consultation process, we're going to target several people. So one of them is we are seeking to consult with all of the member states with their health ministries, and we'll do that. I can't remember the names of the channels, but we've got certain channels. We've had really great support from DigiSante, who've been really amazing at helping us connect with the right people at a policy making level, certainly. But then also, I think for those of you who work in health management, you might also understand that health management as a practice is not just a health manager, a CEO of a hospital, but she or he could work at any level of decision-making about health. It could be a policymaker, it could be someone, a professor of health management. I think of our president, Professor Sandra Buttigieg, who is from Malta. She's a professor in the hospital by day. She's a hospital manager by day, a medical doctor by day, and in the afternoon, she's a professor of health management. I think of Todorka Konstantinova from Bulgaria. She's the vice rector of the University, the Varna Medical School, and also really involved in the health ministry. So our people have reach everywhere. Health management is all of those levels. So we would use the people in our project and their existing relationships as well. We're pushing in all directions. We'll consult explicitly with those different levels, and we really rely on the snowballing effect of the people who are close. And hopefully the people in the room today are thinking, again, I can see on your laptops looking, how do I consult with this B-World project? Well, hopefully on the website, you'll find that. And in January, you'll really see, so do make sure you follow it on LinkedIn and Twitter, because you'll really see that the 8 languages that we're consulting in really broadly to get the views of everyone.
Thank you. And I realize I should have asked the same question to Marta. No, it's only because George is in the room, but I guess for you, it's also a challenge to make sure that your work reaches stakeholders beyond like those directly involved in your project or those countries which are represented. So if you could talk a bit about, your strategy to make sure that your strategy reaches as many relevant people as possible.
Really is a very challenge to involve policymakers and stakeholders. No, of course, in one framework with 14, 15, 20 different partners for different institutions, the framework is multiplying. No, because our experience is that you have a different interaction with policymakers or stakeholders for the same focus, that is well-being or have a good health in the people who work related to health. Finally, it's really important to have co-creation session meetings with reflection or workshop, to incorporate the knowledge and the opinions to policymakers and decision, and also to try to find a cost-effectiveness approach, because for example, I work in a Ministry of Health in Asturias, and the sustainability of the actual model of healthcare is very expensive, So I summarize that find a cost-effectiveness approach with a high level of literature. Is it possible to have a public scientific paper to have a good practice, a best practice is also a good thing, and also involve people in co-creation, decision plan, and activities and strategies. This is our point of view.
If I could add one other comment, another way already we're talking about the difficulties of how do we upskill and reskill people in professions where they're incredibly busy already. And so how do you consult with people who are already busy already? Now, we launched the first draft of the Be Well strategy in Rome at our conference in June this year. And we had the health minister of Italy there in attendance and really supporting these initiatives. So that's one practical way it happens. Next year we'll be in Romania, and we've had we're in partnership with Minister Rafila's the health ministry in Romania. So they'll be co-hosting our conference in Bucharest. And there at that conference, it'll be in June, the EMA conference in June, in partnership with the Romanian health ministry, where we'll have a lot of things on the healthcare workforce, a lot of the other projects as well that I've talked about that'll be there. These are ways people can practically get involved and actually physically network in the good ways you're doing here.
We have still 5 minutes before going to the next tour of presentations. I think that you're raising a very important aspect. So one of the things I would like to reflect on, as we are approaching the end of this workshop, is that somehow we could have a feeling that we need a GPS and navigator to understand what are all the initiatives that are being carried out. So we have seen that we have a lot of initiatives defining different strategic frameworks, different strategy itineraries that also the strategies are different. So some of them that cope or that tackle different healthcare professionals, others that tackle basic digital skills for all the actors of the healthcare sector. So and it is somehow and this is, I think, a question that the policymakers raise themselves. So what is the correct path? What is the approach or the strategy framework that we need to be inspired on to have a good applicability and the desired benefits and outcomes to our system? So George and Maria, just a reflection on this, and what would be, I don't know, your tips to the policymakers?
Maria, I'm waiting on you to to start us.
Really, I think I don't have the answer to this question. I think they are not only one way or only one strategy, only one activity, because it depends of the people, of the illness, of the resource, of the different things. No, so we propose in our strategy tips, no, for prioritize ideas and for politicians or policymakers to decide how to do. No, for example, to use methodologies that handle method for prioritize, or and also I recommend take into account very holistic approach with different things like inclusion, gender, ethics, accessibility, use, etc. No, but I also recommend to see the whole process, no, because digital health literacy is not only see the information, is access to the information, see the information, understand the information, and apply the information. So probably we focusing only in the first or second step, no, but we need to look by the final one, no, that is a price. We have a lot of lessons learned. For example, working with people with chronic illness to face-to-face approach. And I think it's need to move to the digital one. For example, if the if the interaction between health professionals and patients are crucial in face-to-face approach, we need to incorporate this point, for example, in digital approach. No, it's not useful to have only one direction. No, for example. So conclusion, it depends of how to prioritize, how resource you are, no, And I think stakeholders, policymakers need to have a very holistic approach and incorporate citizens and health professionals when decided to develop an digital health literacy activities or strategy or approach.
What I would add to that is, I think of it this way. I grew up in the north of Greece in tiny villages. My grandmother would feed me far too much food and would be having breakfast and I'm so full, I cannot eat another bite. And she would say, "What do you want for lunch?" And I'm like, yeah, grandma, I don't know, I'm full. And then what would she do? She would make manestra for lunch. Manestra is this dish that I hate, but she would make that for lunch. And I didn't have a chance because I was so busy being full to say to her, what do I need in the future? And we have this trouble in the healthcare service. It's the same thing. My grandmother's taught me well, which is we're so busy with what's in front of us. We're too busy. It's too much. But if we don't look ahead, we have to act now. We really have to be looking at what are the digital and green skills planning that we're doing. And if we don't do that, we're going to be left behind in a way that we won't recover from. The Be Well project has mobilized the healthcare workforce. It's mobilized the educators. It's going to give you solutions. It's going to give you a roadmap, and we need you to be involved in it. So the consultation, we need to hear from you, because if we do, we can give you a strategy that will solve your problems. And so I ask you to engage as much as you can. And if that just means coming to one small consultation, that's great. And we would really appreciate that. So make sure you follow the website, Twitter, LinkedIn, and let's keep talking. Thanks for having us.
Okay, thank you so much, George and Marta.
Thank you.
There's a question. I'm sorry, I haven't seen. Yeah, there is still a question.
Sorry to keep you. Thanks for the presentation. A question about Be Well, because I'm a simple doctor and a medical educator, and it kind of flew over my head a bit. So maybe you could clarify. So me as a medical educator trying to better the digital skills in my university of our students, how can I use Be Well to do that, to change the curriculum? Or is it for me, or is it for the universities and changing the curricula, or is it for someone else? Because I had kind of...
Thank you for your question. These are exactly the questions we need. And what is your country setting or your region?
Estonia.
Estonia, wonderful. So so the way that you get involved in this way is if you're a member of a professional body, it could be any of the professional networks, we are listening to their voice because they're speaking for your colleagues en masse. If it's your hospital, they can speak to the Be Well project as well en masse. You as an individual will be able to respond to the consultations that we launch in January 2024. Estonian won't be one of the languages, but there will be 8 other languages. So respond to the consultation and tell us what your needs are, because in the end, you'll get a roadmap that will give you really a course of action that you can take back to your setting and say, here are the actual things that we can do. And this matches the challenges that we're having because we fed into it. So that's kind of one way. There might be more nuances to that. And maybe after this discussion, I'm happy to speak to you one-on-one. I'll still be around. But at a higher level, that's how it is. I'll start with that, but let's follow up and I can give you some more direction.
Okay. It's clear, yeah? Okay, so thank you so much. It's a start, yeah. So thank you so much, Marta, also for the presentation.
Thank you.
Okay, and now, so we are going to open a new block. So it is going to start the overview of the European Union funding opportunities. So I will leave the floor to the E4Health program. So, and I call Christoph, I will not pronounce well your surname, Spegel. That's fine, okay. So welcome, Christoph.
That's for the slides, yeah? Okay, and that's forward, yeah? Okay, perfect. Ooh, that's a new slide. Okay, cool. I like this, okay. Yes, so Thank you very much for the floor. Thank you also for inviting me and giving me the chance to present DG Sante's action on digital skills for health professionals in this workshop. Yeah, I think it's great also that that you invited George and the Be Well project. He's always a great speaker, and yeah, they are one. Be Well is one of our key initiatives, as you will learn in a minute. So my name is Christoph Spegele. I'm a German seconded national expert, and I work at the moment at the European Commission DG Sante in Unit C2. And we are concerned with the cycle state of health with health systems, the European semester and health technology assessment. I'm part of a small team within our unit who works on health workforce, specifically on as well on our own initiatives, but we are also involved in cross-cutting initiatives of other DGs. I'd like to, let's see. Yeah, I'd like to start with a quote from President von der Leyen's State of the Union address in September 2023, so very recent. And she really highlighted the importance of skills and workforce shortages as a key challenge for the EU. And she said, instead of millions of people looking for jobs, millions of jobs are looking for people. Labor and skills shortages are reaching record levels, both here and across all major economies. And in her speech, she also explicitly mentioned the health sector as one of the sectors which have key challenges with workforce and skills shortages. Yeah, if you also look in the statistics of across the EU, Eurostat, then yeah, the health sector is really one of the key sectors with shortages in that respect. So her speech is put a highlight also on the topic which we are discussing today. I also like to raise your attention to the state of health in the EU report, that the state of health in the EU is a biannual cycle run by the European Commission. And it examines basically very important developments in the health systems in the member states. And the last cycle in 2021, I thought had some very good key takeaways which fit for today's workshop. And the first takeaway was that we need to understand the far-reaching health impacts of the COVID-19 pandemic, and then that we need to lock in the advantages of digital innovation and in healthcare delivery and for public health. Because the COVID-19 pandemic induced a rapid acceleration of the use of digital tools, of teleconsultations, etc. And we need to carry on this momentum for the benefit of the health system without creating additional obstacles for an additional work for health professionals. And the third key takeaway, which is relevant for our workshop, is that we have to rethink health workforce strategies and planning after the COVID-19 pandemic, because Europe had very significant challenges in terms of health workforce already before the pandemic, but the pandemic really put the health workforce and the shortages in that sector into the spotlight. So we need to rethink our strategies and our planning attitudes, and we need to inspire more young people also to become health professionals, and we need to keep existing health professionals in their jobs. My next slide gives you a general overview of my units or DG Sante's actions on health workforce. So we focus basically, yeah, as a consequence of what I just told you on the two areas, skills, and then on the other hand, workforce shortages and working conditions. I will be very short to point out, of course, that for skills, we have as one of our key actions, the Pact for Skills partnership in the health ecosystem, Be Well, which George just perfectly presented.
Then we have also, on the terms of shortages, we have a cluster of 5 projects which deal with the key topics: medical deserts, which means areas with a reduced supply of medical services, task shifting, and workforce retention policies. And these 5 projects are funded under the 3rd EU health program, so the last funding period, but they still continue into the current period. And they facilitate exchange of best practices. They do research, and they develop policy recommendations to enable member states, or to help member states to deal with, for example, with issues caused through medical deserts, and to improve workforce retention and innovative approaches such as task shifting. I'd also like to quickly mention the HEROES Joint Action, which is also for us a very relevant action in the area of health workforce. This joint action was launched in February 2023 with 18 member states participating, and Italy in the lead. And the aim is to progress in forecasting skill mixes and the professions we need in healthcare. And the joint action will also increase the capacities of member states in developing and putting to use specific planning and forecasting tools. The 4 main areas of that joint action is databases and data collection on health workforce, supply and demand, forecasting tools and planning methodologies to address future workforce challenges in the participating countries, the development and improvement of skills and capacities for effectively managing the workforce at national level. So this is also about skills, and methodologies and good practices to ensure a comprehensive and effective stakeholder mapping and involvement at each stage of the workforce planning process. This is just a little bit of a context. It's not directly on digital skills, but it shows also the importance of skills in different areas of the health system. And for example, also to have skilled health workforce planners. Good. Then I have also on the slide the European semester, and closely connected with it, the Recovery and Resilience Facility. The slide is unfortunately, as I just see, not quite up to date, because of course we have already the European semester 2023, where a total of 12 member states received, either through country-specific recommendations or through the European semester country reports, recommendations to address reform challenges in their health systems. And health workforce is also one of the areas that was highlighted through the European semester. And of course, connected with it, the Recovery and Resilience Facility, the big funding instrument with a budget of over 700 billion euros. There I have to say that health resilience is one of the key pillars of the Recovery and Resilience Facilities, and that all member states have submitted their national plans with reforms and investments, and they also cover health, and some of them also have included actions in regard to the health workforce. So, okay, I think I'll just skip this. So this is the Pact for Skills partnership, which just was presented. We will have with BeWell a large-scale partnership. Within the Pact for Skills, we will have, for the first time, a green and digital skills strategy for the health ecosystem. And we will have pilot training programs on green and digital skills as key areas for the health sector. So we're also very grateful that George presented here today his action. And yeah, we are delighted to have Emma on board as a coordinator for this project. And now to the core of my presentation. We have in 2022, we have launched a call under the EU for Health program for workforce training. The objective of this call was to address skill shortages by strengthening the continuous professional development and training through updated or new training courses. And the call gave us a framework that the training courses should include modules for medical professionals, meaning doctors, nurses, etc., but also for non-clinical staff in the health system, for example, who are involved in the procurement, health planning, and health management. And here again, you see, like for HEROES, for the joint action, we also want to include administrators in the health system into our re- and upskilling initiatives. And the training projects shall have a focus on strengthening digital skills, which means digital literacy and the use of digital health tools, or skills required to deal with other pressing health challenges. And we receive, or at the end of the call, 7 projects were selected for funding. And I brought them here on this slide more in detail. And I quickly explain a bit about them. So the first project is called AMR Educare, to mention that all these projects have kicked off in the first half of 2023. So they are already underway, but they are also very recent actions. So AMR Educare is aiming at improving skills for the responsible use of antimicrobials and the reduction of antimicrobial prescription. And it will provide training opportunities for doctors, nurses, and health management professionals in 6 member states. And the aim is to train over 4,000 people. The next project, which is also underway, is called eHospital for the Future. This project will promote digital skills in hospital settings, including in digital practice, in clinical practice, the use of data and AI, and management aspects such as patient management and hospital management. The project will also include training on stress handling and transformation of primary care and long-term care, and it aims to provide training to at least 1,000 health professionals in 5 member states and 2 non-EU countries. The next one, I will tell you the long name because with the short name, you can't imagine really what it is about. It is gynecological endoscopic surgical education and assessment for Europe. So this project will provide training for doctors and nurses assisting in gynecological endoscopic surgeries and participating in the follow-up with patients, including through remote consultations. It will also include robotics, motivation, and communication skills. Oh. Yeah, okay. In health professionals. And here they aim to train at least 600 professionals in 8 member states. The next one is called DigiCan Train, and it is about the digital skills training for health professionals in oncology. This project will provide training opportunities for doctors and nurses in oncological care, focusing on interprofessional education, communication skills, skills required for person-centered care, and a number of other skills, including data and AI, and skills for remote consultations. It will also include modules for clinical staff, non-clinical staff, to improve the organization of cancer care, strengthen crisis response, and leadership in healthcare. And here they aim to train 240 persons in 6 member states. The next one is HPass. And this project will aim at providing training on general and advanced digital skills, transversal skills to manage change and reach digital maturity in healthcare settings. It will also develop a digital literacy strategy and plans to improve the health digital literacy. The penultimate one is DDS Map. That is also a digital skills project. This project will provide training for doctors and nurses to strengthen digital skills and their preparedness to deal with current and emerging issues in healthcare. It will also include a module on well-being of health professionals in multidisciplinary teams. And that will target 700 people in 9 member states. And the last one is transition. It is also on digital skills in oncology. So it will provide training opportunities for doctors and nurses in cancer care to strengthen their digital skills and other relevant skills needed for search capacity and resilience. This project will also provide courses to improve shared decision-making, cancer prevention, monitoring, and supporting care. Finally, it will include also modules for non-clinical staff, focusing on the improvement of the organization of cancer care and digital innovation. And here is the training target, I think 10,000 professionals in 14 member states. So that was a short overview about our actions under the EU Health Program and also under other training programs or under other funding programs. And now I think I've also made use of my time and hand over the floor to my next colleague. Thank you.
So thank you so much, Christoph. Amazing the number of initiatives that are being held under the EU for Health funding. So now we will have the opportunity to, it is also a remote connection, to hear Digital Europe program in the voice of Gaia Butura from DJ Connect, also from the European Commission. Hello, Gaia, you can proceed.
Good afternoon. Yes, would it be possible for you to share my slides? Thank you very much. Good afternoon, everyone. If we can go to the next slide. Thank you. So I would like to start my presentation today with some introductory words on the policy context. Skills overall, and especially digital skills, are a top priority for the EU. First and foremost, this is reflected in our President's decision to declare 2023 as the European Year of Skills. But it is also evident in the ambitious targets on digital skills that we have set in our Digital Decade policy program. So first, by 2030, we want to ensure that 80% of Europeans have at least basic digital skills. The second key target is to have 20 million ICT specialists employed in the EU. This would be 10% of the total employed population, so a rather significant share. In addition to this, the Commission also published the Digital Education Action Plan in 2020, which aimed to support member states with several concrete action points in the area of training and education. One of these concrete actions was to conduct structured dialogues with member states on digital education and skills last year. This deep dive exercise really followed a whole of government approach, as several Commission services, including DG Connect, as well as different ministries from member states, took part in these dialogues. As a follow-up to these dialogues, the Commission then came forward this April with a Council recommendation in the area of digital skills. It includes many different recommendations targeted at member states that tackle education and training at each level. At the moment, this document is in review at the member state level. Next slide, please. So are we on track in achieving our targets on digital skills? The truth is that we are still quite far away from reaching our target to have 80% of adults with basic digital skills in 2030. Given that we are 26 percentage points below at a share of 56%. Moreover, today we are also quite far away from the target for ICT specialists, as we only have around 9 million in the EU. On a positive note, we know that the number of ICT specialists has grown significantly over the last decade. More specifically, it has grown almost 7 times as much as the increase in total employment. Although these numbers are encouraging, it is still not enough because if we maintain the same trajectory of the last years, we will simply fall short of the 20 million targets. So more efforts are needed. We also need to ensure that the advancement in digital skills is mainstreamed across all member states, as well as across population groups and relevant sectors of the economy. At the moment, the share of ICT specialists is quite unevenly distributed in the EU. From the bar graph on the screen, we can clearly see that some countries are doing much better than others, such as Sweden, which is a top performer, while other countries like Romania or Greece are lagging behind, with shares of ICT specialists well below the EU average. Another major issue that we still have is the gender gap, as only about 1/5 of all ICT specialists in the EU are women. And lastly, another important element, which is closely related to our meeting today, is that there is also a high need to equip sector specialists with advanced digital skills, such as, for example, medical doctors, who are increasingly relying on advanced digital technologies to provide more accurate diagnosis, to train future doctors, or to process the data of their patients in electronic health records. Next slide, please. So now I would like to move on by presenting to you a selection of initiatives for which DG Connect is responsible, which will involve activities along the full education and training spectrum. This is just a small proportion of what the EU is doing in the field of digital skills. So, sorry, this is really one concrete action which might be of interest to the audience today. Under the Digital Europe program, we have launched or will soon launch several open calls for proposals with the aim to design and deliver bachelor's and master's programs in the area of advanced digital skills. More precisely, we are co-funding projects that either develop programs to build up advanced digital skills in key capacity areas such as AI, extended reality, or other technologies, or programs that develop interdisciplinary programs in specific sectors such as health or energy, for example, or even programs for students who graduated from non-ICT fields to access specialized master programs. The projects can also cover activities to attract qualified teaching staff, scholarship for students, the purchase and leading cost for equipment, and cover the cost for other activities to establish partnership between academia, industries, and research centers. Next slide, please. So why does this matter? Why are these calls so relevant? The rationale for these specific calls is that we clearly do not have enough study programs in the area of key digital technologies in the EU. The graph you see on the screen is from a study from the Joint Research Center, which showed that the number of bachelor and master programs in the three areas of AI, high-performance computing, and cybersecurity in all member states together is lower than the academic offer in the UK and in the US. The study does not include data from Asia, so I cannot share that comparison, but already from the data we have, it is clear that more programs in this area are necessary in the EU. Next slide, please. So within this program, we have already funded a range of different projects in the area of boosting advanced digital skills in health. You have already heard about one of these, the IDEAL project, in the previous session. But we also have another project delivering an advanced digital skills program in the area of AI and health. It involves universities from France, Italy, Sweden, and Spain who deliver a common curriculum. Each partner university provides a specialty in a master program. For example, the University Aix-Marseille provides a specialization in AI and biomaker, whereas the University in Barcelona provides one in AI and big data. The project also offers several massive open online courses in synergy with existing master teaching unit, which are accessible on the platform of the Stockholm University and which result in the delivery of a digital certification. Lastly, the project also offers 3 short-term training courses for professionals in the area of AI and health. Next slide, please. Another example of a project in the area of health that is supported by the Digital Europe program is the DS for Health. This project basically aims at providing a master's program offered by an international alliance of universities, which you can see on the slide. And it aims to increase the digital competency in those already working in healthcare or those interested in transitioning to the field of digital transformation in healthcare. The program will address key applications of AI, cybersecurity, data, robotics, and the Internet of Things. And the consortium for this project really aims to approach students with a background from clinical, medical, and life sciences, such as clinicians, other healthcare professionals, scientific researchers, etc. Next slide, please. So the Digital Europe program is also supporting the digital skills and job platform. The platform provides access to a wide variety of high quality information. This includes best practices, training opportunities, resources on the topic of digital skills and in the area of health as well. It also has collaborative spaces which enable communities at EU level and national level to work together and collaborate on these topics. Next slide, please. I invite you to check out this platform and search for content related to health because there is quite a lot of material. For example, under the section of good practices, there are many good practices related to health, such as this one on the screen from Spain on the creation of a methodology for digital skills management of health professionals. But there are also many opportunities for training listed if you search the term training together with health. For example, the one on the screen is called the Digital Skills for Better Health and Wellbeing. And on each of these pages, you will see information, but also a link to the dedicated website with more concrete information and points on the various opportunities. Next slide, please. Thank you very much for your attention. This was all for my presentation. It is quite a lot of information, so I would encourage you to visit this website and familiarize yourself with them. And of course, you can send your questions to our colleagues in DG Reform, and we will be happy to answer you. Thank you.
Thank you so much, Kaya. So I've seen that there is an online question to Christoph. Christoph, if you could come here. And while we project the question, so we are approaching already the end of the session. So I would invite to come to this table to the representatives of the member states. So Sabina, yes, you can go there. Sabina, Lisenda, Katre, and Alexandru. Okay, if you can come here to close the session, okay? And yes, and let's move for the questions and answers. So I've seen that there is one online, but also the ones that are present, feel free to ask questions for the presentation on the EU for Health program and also on the DJ Connect presentation. Go ahead,
Okay.
Jana.
Thank you. Okay, so this is a question from Ms. Bianca Popescu for the first speaker, and it goes, how are the training projects going to be scaled for the countries that are not currently targeted in the current programs? Is there a strategy to approach this issue? Thank you.
Is that on, or do I need to press like a button? I don't have a button.
We can hear you loud and
Okay.
clear, so
Okay,
you can go
perfect.
on. Thank you.
Well, most EU projects, they have different work packages. They are structured like that. And a typical work package of EU projects is also exploitation and sustainability strategy that determines then, or each project has to determine a strategy how the results of the project can be upscaled or can be used also after the end of the projects typically.
Thank you for the answer. If there is any feedback, I will let you know.
Okay, any other question? Okay, so thank you so much, Christoph. Okay, so now that we are approaching the end of the session, we have made a summary. So there was a huge amount of information during all day. Perhaps next time we meet, we would need 2 days to go and dig deep each one of the initiatives, because I think that everything that was presented is very interesting. And I also must emphasize the dynamic pace and evolution of this area of digital skills training, because when we first started to in our project to look at the good practices on these initiatives, we didn't have so many results as the ones that we are now. So, and we are 1 year ahead of the starting of the project. So this is very also good to know. So we are delighted to know that so both from the member states and from the European Commission, there are convergent initiatives that perhaps have slight differences, but I think that we are all sharing at least the need and the urgent need to upskill the healthcare professionals, also citizens, because they have to go alongside. And we have had the opportunity to see the experience from Italy, Romania, Estonia, and Catalonia. So even though they are in different stages of their development, of course, they are facing some common challenges. And so the strategy that you are developing, of course, that perhaps will have different aspects and have to be tailored to the needs of each one of the challenges that you have under your healthcare system, if it is more fragmented or less, if the health professionals are more willingness to participate or not, if the country is more digitalized or not, if there are more resistances or not within the healthcare professionals. But at least it's very nice to see that this seems to be a way forward, that we cannot move back. And also from the lessons learned and the benchmark that we have done, and all the presentations that were performed here. So I would like to emphasize that so the government support, it seems to be a key factor in order for this type of initiatives to go ahead. So ICANOS, I think it is a very good example on the institutional need for the governmental support, and also to have funding to be able also to cope with the huge amount of trainees that in different areas, as Christophe was now, and it was impressive the numbers that you have shared, Christophe, and different areas that were need to train the healthcare professionals. So there is a long way still to do. I would like also emphasize of the need to have these stakeholder implications. So we need professional unions, associations, colleges. We need also the universities, so the pre and postdoctoral areas. So this consensus and the need to urge all the stakeholders to be together and to do this, it's really important. Then I think that we still need to dig in on learning from these good practices. So as there are several movements there, so I think that, and here the European Commission has a very important role on doing this type of practices or initiatives, when we can share the lessons learned and the challenges that that each one has faced. And then I think that one of the things that was very clear is that we need to start. So we have plenty of digital competencies frameworks. They can have some differences, but it is urgent to start. It is urgent to train the trainers. It is urgent to train the professionals and include all the stakeholders, not only the clinical professionals, but also the non-clinical professionals and managers in the area of digital skills. So here also one important thing that we have learned also from the American Santé is that from the governmental strategy, it's very important to start to review the curricula of the new professionals and not just focus on the upskilling of the current professionals, but of course that we have to combine both things, so curricula of new professionals and the lifelong courses. And also there will be a great challenge on how we will update these courses, because the evolution of the technologies is going to be high and is exponential. And so we have also to pay a lot of attention to this. Another thing that I think it was a message that was emphasized by a lot of presentation is we have to take care of the healthcare professionals. So they are on a lot of pressure. So if we ask them to do more or to do more training on digital skills or green skills, so we have somehow to support them to carry out this training and not just to ask more. And then also so to work alongside on the benefits that they could have of getting this digital upskilling, such as reducing the administrative burden of their daily life. Yes, another important thing is that so digital skills also will help us to work more efficiently. And will help somehow to cope with the two great challenges of today's healthcare system, which is the increase of the expenditure and also the shortage of professionals. And so, and here, of course, there are several strategies that have to come alongside to cope with these two challenges. I take also the note from George of the new professionals and new roles that we need in the future to cope also with this. So we have to think sometimes disruptively, and this is, I think, also disruptive. And I would say that it is all. So the support on EU for Health initiatives is, and also from the DJ Connect, it is very important to foster also all these digital upskilling. And I think that we close this session. We are going to close this session with, I would ask for a sentence of each one of the representatives of the member states to know what do you take to your country after this workshop, and then I will give the floor to Raluca to close. But I would say that fortunately, with all the initiatives that we see here, we do see that 2023, it's fortunately the year of the digital skills. And so let's try this year to go in the next years, because this is something we cannot stop, and we have to give a very strong push to this to happen and to finally and better the care for patients, that it's what we are pursuing with all the work. So thank you so much. And now I would give the floor starting to Sabina. So the question is quite simple. One thing that you take for your country after what you have seen here in this workshop.
Thank you very much again. So definitely, I would say that after participating to the enrichment of today's workshop, I would say that the main takeaway is collaboration and integration among initiatives, both at the national and European level. Thank you.
Thank you.
Thank you. Amazing day. Thank you for that. A lot of sharing, share experience. For sure, we need to do more together.
Thank you from my side as well. All the presentations were very interesting, and from my side, I would add in first agree and then add in that it's essential for us to understand the ecosystem of the health sector in our countries to make sure that when we move forward with the digital skills strategy planning, then we do it the bottom up, that we make sure that we have included the bottom up way of approach, because like it was mentioned, it's already a lot of in their hands, and it has to be coming up from them, the healthcare professionals, to see the value of the digital skills. So that's our way of thinking now, how to bring that value visible. Thank you.
Hello, thank you. So actually, from my point of view, our project is mainly focused in active professionals, no? So how to upscale active healthcare professionals. So what we are going to take home is homework for our colleagues of the universities department. So we are going to try them that they see some of the initiatives that have been presented here, and they also think about changing the curriculums and therefore to have some professionals in the future that they are already prepared, and the current training will not be needed, maybe another one. So that will be what we take home with us.
Okay, thank you so much. We still have time for comments. If anyone wants to make any comments, so feel free. No? Okay, so I invite you when we close the session to exchange contacts, because I think you have to all to be in touch for the next years. And Raluca, please, I give you the floor to close the session. Thank you.
Thank you, Liliana. I would like, first of all, to thank all of you for taking the time to travel to Brussels, for being here today, for exchanging. It was very interesting to hear the different perspectives, but also interesting to see that the most difficult challenge is really the process. So accompanying people in changing the way they work and incorporating the new tools in the way they function. I hope this is just the beginning. We are trying to set up, as we progress with the implementation of the projects, other opportunities to meet, to discuss. But many thanks also to the guest ministries that shared their experiences here in the room, but also the French representative and the other colleagues that joined online. Also, many thanks to Liliana for all your effort in trying to organize the big event, to the colleagues, the TAIEX team, also our technicians, the interpreters who made this possible, and our colleagues from the European Commission who came here today to share experiences, and also how we support through other ways your efforts in the member states. Also happy that we had George with us today. And I will also have to point to the fact that DG Reform and the technical support instrument is here for the long term. You know, we function on the basis of this annual call for interest. Every year we receive the projects by the end of October. It might be too late to apply this year, but there are also the next rounds. And I would like to point out to the fact that we are using the projects we're having with you to also encourage other member states to apply for support in the area of skills, because for next year we put forward a flagship on skills. So really telling member states skills, you know, with its many angles, many sectors, is something that we can support you with. So I'm glad to hear you had enjoyed the discussions, and I wish you remaining few hours of nice day in Brussels, despite the weather. Thank you.
Sorry, one more request. Could we please all come on stage so we take one group picture and then we have coffee? Thank you.
1, 1, 2. 1, 1, 2. 1, 2, 3. 1, 2. 1, 2, 3. 1, 2. 1, 2, 3. 1, 2. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2. 1, 2, 3. 1, 2. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2. 1, 2, 3. 1, 1, 2. Vous dérangez 2 secondes.
Vous ne dérangez pas.
Vous me dites si vous m'entendez et si vous voulez juste payer d'abord l'anglais et puis l'espagnol. Voilà, vous m'entendez? Vous parlez dans le canal espagnol? Ça, c'est le 1, c'est ça? Ah, bon, attendez. OK, maintenant j'entends l'anglais, oui. On essaye le 1? Eh bien, merci, tout fonctionne. Merci, hein. Un, deux. 1. Un. Ou. Un. Un, deux. Un. 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 Un, deux. Un. Un. Ya. Eh bien, voilà. Normal. Un, deux. OK. O. Deux. Un, deux. Un, deux. Voilà, là, je parle dans les micros. OK, merci.